Good morning, folks. We are, oh, I broke my own rule here. We are on mic here in the Appropriations and Financial Affairs Committee room, doing our interim meeting in, I believe it's September. Glad to see such great turnout from members of the committee here in Augusta today. Very appreciative of that. So as we've done with our other meetings, we're going to start with a quick round of introductions. Then we're going to go off mic just hopefully for a couple minutes as people, some members disperse into other rooms throughout the State House. And then we'll come back and we will start our agenda. So why don't we start introductions on the inner circle, starting with Representative Martin.
Thank you, John Martin, House District 151, Northwestern Aroostook County.
Hi, Teresa Purse, House District 44, the majority of Falmouth.
Good morning, Nate Wadsworth, District 70, Southern Oxford County.
Good morning, I'm Sowen Millett from District 71, towns of Norway, Sweden, Waterford, and West Parrot.
Good morning, Senator Linda Sanborn, Senate District 30, which is Gorham, Scarborough, and Buxton.
Good morning, Michelle Dunphy, District 122, which is Old Town and Indian Island Voting District.
Good morning, my name is Amy Arata, and I represent District 65, which includes New Gloucester and part of Poland.
Good morning, I'm Dennis Keschel from Belgrade, Maine, and I represent House District 76, which includes Belgrade, Fayette, Mount Vernon, Rome, Vienna, and Wayne.
Senator Breen.
Thank you, Mr. Chair. I'm Kathy Breen. I represent 6.5 communities in Cumberland County, and I serve as Senate Chair of Appropriations.
And I am State Representative Drew Gattine. I'm the House Chair of the committee. I represent part of the city of Westbrook. Again, so as I mentioned, we're going to go off mic for a couple minutes. Some of the members are going to be attending from other rooms in the building. So folks will bear with us for just a few minutes. We will be right back.
IT next to it, so I wonder why.
Yeah, I hid myself just because they don't need to know that I'm there. They know I'm there. Okay, thanks, Rick. Okay, thank you.
Okay, it looks like folks are settled and online. I neglected to mention that there are other members of the committee who are probably going to be joining us a little bit later in our session today. Senator Hamper, Representative Hubble, and Representative Jorgensen. So let me quickly run through the agenda and then we will get started. We have a number of items. The first part of our agenda is really going to be devoted to issues related to main care and other DHHS funding issues. We're going to start out with Luke Lazar from OFPR walking us through the main care caseload and expenditure reports, the latest one. And then we're going to have representatives from DHHS presenting to us about main care state and federal spending, their updates and projections, their thoughts on the impact of the pandemic on enrollment, provider operations, and other DHHS funding issues. Hopefully around 11:30, we'll be moving to updates from DAFs. First, we're going to hear from Dr. Michael Allen regarding the latest revenue report. And then Commissioner Figueroa is going to update us on allocations from the COVID Relief Fund, implementation of Economic Recovery Committee recommendations, and any questions that members of the committee have related to the recent curtailment order from the governor. And then the last item on our agenda, which is scheduled to begin roughly around 12:45, we're going to be joined by Commissioner Heather Johnson, who's going to give us an update on the governor's main economic recovery grant program. So again, we've got a pretty full agenda here of items that I think are pretty of a pretty strong interest to folks. So that being said, why don't we kick it off? And I'm going to turn it over to Luke Lazar from OFPR. Luke, welcome.
Thank you, Drew. It's good to see all you representatives and senators. It's been a little while. So I am going to present to you today on 4 documents. I tried to break them up in the packet by part A, B, C, D, so we all know where we are. Maureen also did a great job of numbering the pages at the bottom, so hopefully we can keep together. There's only 16 pages here. I'm just going to summarize all 4 documents as we go through them. 2 of these documents are documents that I send to you monthly that I receive from the Department of Health and Human Services. And one of those files is on expenditures, one is on caseload, so I'll quickly walk through those. And there are also 2 files I'm going to be presenting on that are files I create for our OFPR website. There's an other fiscal information section on our website, and we put these files up quarterly. So each quarter you can go and see the new files, and there's expenditure and caseload file along with a few other important files. So with that, I'll jump right into the first file. So it's listed as the Part A, and this is a Medicaid expenditures file. This is the one that I receive from DHHS monthly. It's called the weekly file because when you look at it, it's through a certain number of weeks. But we receive it monthly and we send it along to you monthly. So if you look at page 3, I'm not going to refer to this page today just because, as you can see, it's a large page with a lot of numbers that are hard to read. So I'm not going to try and drill down to all the numbers on here, but I just wanted you to see this is where the information I'm talking about came from, because this file, since I sent it to you monthly, I figured you'd recognize it at least. So if you move to page 4, you'll see that I just included a small portion of that file. And this has all the general fund accounts that are considered the main care accounts. This is through the 52nd cycle of state fiscal year 2020. So that's through the last cycle of fiscal year 2020, which ended June 27th, 2020. That was the week it ended. So if you look at the far right two columns, those are the two we'll zero in on. The second to last column is called the 2019-2020 allotment. This is the available funding that they had at that point of state fiscal year 2020. You'll note that that number is quite a bit larger than what was appropriated and allocated by the legislature. That's due to pulling forward balances from previous years and other changes that they may make within the accounts to make the allotment greater than what the original appropriation was. So that's why we look at the allotment, because that's the amount of money that they had available to spend at the end of state fiscal year 2020. The last column are the actual expenditures in state fiscal year 2020. And the bottom line number of that is $840 million of general fund. You'll see that when you compare that to the allotment, which was $970 million, that leaves about $130.5 million of unspent funds in the main care accounts at the end of state fiscal year 2020. And I'll use that number to refer to another document that I'm sure you've seen. The Commissioner of DAFs sent along a file to the governor outlining her proposal for curtailment. And in that, it noted setting aside $125.1 million of general fund dollars from multiple sources. This wasn't just FMAP, but FMAP was a big piece of that. I'm just pointing that out to show that this $130.5 million, that's where it is within what was proposed for the curtailment. So I think that outlines essentially where expenditures were at the end of the year. Are there any questions on that document or that note I made?
So Luke, and again, just to clarify something, I think is probably obviously, Bill, those allotments and year-to-date expenditures are general fund expenditures. That doesn't include all the federal money that.
Correct. This
goes
is
into the
just
program.
general fund. Yeah,
Right.
the larger file that is the original of this file outlines general fund, fund for healthy Maine, other special revenue, and federal. It has everything, including, it also includes the main care admin, which this does not include. So that,
sorry.
the larger file has everything, but I trimmed it down here to just what's general fund.
Right. So again, when the fiscal year turns over and the first reports are generated from the new fiscal year, the amount in the allotment section stays stagnant unless additional money is made to the administration. But the numbers in the far right column basically go back down to zero, and then they start to build up again over the course of the fiscal year. Is that right?
Correct. But I would note that the allotment that you start with in 21 is really based off what the appropriations are for 21, because the allotment only increases as they actually pull money into the next year. So it starts at a lower point, but money would get moved into that eventually, increasing the allotment. But yes, the allotment is at the appropriation level. The expenditures will go down to zero and we'll start this all over again.
And again, underscoring something that I think people probably understand the amount of spread between those two columns at the end of a fiscal year, I imagine of that magnitude is pretty unusual, and that in a normal fiscal year, there would be some difference, but it wouldn't be anything close to $130.5 million.
Correct. Right? That is a much larger number than I think we're used to seeing. And there are multiple things that played into that. Obviously, one big one being the FMAP increase that came along with COVID. And in a document that I'm going to show you later that I prepare, you'll also see what is at least partially an impact of COVID on the expenditures. We can't be specific about how much of an impact it's had yet, but I at least have some idea of what's going on. And you'll see that in a bit.
And we have representatives from the department following behind you. We can ask them some of these questions too, but we also had slower uptick than we might have expected among the expansion population. I mean, could that have accounted for some of that spread also?
Yeah, the uptick did not get to the level that was originally appropriated for. It took a while to get up. there was a consistent increase. And again, on a file I'm going to show you in a bit, you'll see that from January 2019, when expansion began, through now, there was an increase going on because of expansion. But it didn't get to the level that was originally appropriated for it. So yes, that would have an impact because the amount of money that was set aside for expansion in the budget, we didn't spend all of the general fund dollars that were put aside for that. So that would play into this as well.
Okay, thank you. I don't know if anybody else has any questions at this point, or we'll just let, go ahead, Representative Millet.
Thank you, Mr. Chair. Just a brief question to the House Chair's questions about the 130.5 difference and the 125.1 set aside and curtailment. Would the difference between those two, the 5.4 million, be considered unencumbered balance forward to the main care accounts?
I'll have to be clear again that, sorry, I brought up the curtailment order just to show you where funding from the FMAP was sort of housed within that and how it refers to this. But that 125.1 million was not all FMAP. There were multiple other things included in there. So I think the department will later probably be speaking to this some about how much was actually set aside for this. But essentially, yes, any amount under the 130 million would essentially be money that could be carried forward next year. I would also note, though, that the way that weekly file works, I don't believe it actually accounts for every single last dollar spent in the state fiscal year because it's done through the week ending June 27th. And there were 2 more days of the year after that. There wouldn't be a large amount of expenditures because the majority of the expenditures are the cycle, and that was the last cycle of the year. But I'm sure there were some other expenditures. And so the difference isn't going to be 130.5 million. That's just the closest number I can show you based on the documents I had.
Okay, thank you, Luke. I don't see any other questions right now, so I want you to plow forward. Thank you.
So next I'll move on to the Part B, which begins on page 5. And this document is one of the documents that I create each quarter and is posted on the other fiscal information section of our website. This one is specifically about the expenditures in main care. So if you go to page 6, you'll see there's a number of pages here, and I'm really going to refer most just to the summary that's at the top that outlines what the expenditures were. And I'll walk through the important parts of that. But I might be referring to some of the tables and charts that are attached as well. So first, I'll just note that in state fiscal year 2020, the all funds spending in the main care accounts increased by 280.1 million over fiscal year 19. Now that number was definitely expected because of Medicaid expansion. And I will refer you to a chart on page 7, so the next page, which shows you the all funds. And again, I'm just being clear, this is all funds, Medicaid expansion spending. And you'll see the state fiscal year 19 amount was 54.2 million. The state fiscal year 20 amount was 307.3 million. That's a difference of 253 million. So of that 280.1 million difference in state fiscal year 20, over 250 million of it was due specifically to Medicaid expansion. So that increase was not unexpected. Obviously, there were other items in the budget as well that increased the spending within main care. So that's where when I do this each quarter, I try and outline where I think we are in expenditures and whether it seems out of the norm. And this did not, because we sort of expected this all along.
And again, when you say all funds, this is general fund and federal dollars in this chart?
General, federal, other special revenue, fund for healthy Maine. It's everything. Yeah. So the other thing I wanted to point out, so on page 9, there is this table that I created specifically for this particular report that I did. It's called Main Care Expenditures Table 3. And what this table shows is that there was an interesting development in the final quarter, which I think was expected, that the overall expenditures in the fourth quarter were down 27.5 million compared to the fourth quarter of last year. Now, because we know that hospitals for a while were limiting the services they were providing, doctors were completely closed for a while, dentists were completely closed for a while, along with other services. This is not totally unexpected. We did expect there to be some decrease due to COVID. We still don't know exactly how much it is, but what I can say is that 27.5 million, at least a big portion of that is due to COVID. Because there were not other large differences that I could identify that really pointed to any one area having this difference. So that's just something we're going to keep an eye on going into fiscal year 21 to see exactly what happens. Because when we do look at the caseload, as we move into that, you will see that there is an increase in caseload that we can also attribute to COVID, at least to some extent. And so those two things normally wouldn't line up, but I think because of the slowdown of services that occurred from March through April and probably through a large part of May, it's not so surprising that in that one quarter we had a decrease in expenditures. It's something we're definitely going to have to watch as we move forward.
I think there's a question from Senator Breen.
Thank you, Mr. Chair. I just wanted to highlight for the committee and anybody else watching down on the 18th item, school-based services, down 66%. So, you know, there are a lot of kids in schools all over Maine who get services that are paid for by Maine Care on their school premises. And obviously when schools shut down, those services weren't happening at the schools. So I will be very curious to see when well, obviously looking back, we have retrospect, but now that we are in school year again, I'll be really curious to check in with DOE and Maine Care and see how schools are able to provide those services now in this new environment. So I just wanted to, that's a very dramatic decrease in utilization. Thanks.
Luke, I had one question that I'm trying to understand a little bit about how, was this created based on data through the end of the fiscal year, or is this from claims data that's more recent than that? I know there's a lag in terms of, you know, the payments, you know, running through the payment system, that again, with hospital claims and such, and institutional claims can, you know, it can take quite a bit of time. So how much real-time data is this based on?
So this is data from the accounting system. So that means it's based on the payment date, not the service date. So there's definitely, that's why we're not really surprised to see the fact that there's a decrease for these 3 months, because there's going to be a claims lag from the slowdown that occurred that'll go even further than that. When we look at claims, it's always hard because it depends on which service it is. Some services, it's very consistent when their claims come in. But in general, we sort of look at it as a 3 months claims lag. That's what we used to always do when we were trying to figure out, well, when will we see this come in? I don't have the claims data, so I can't look at things by service date. So I have no way of really trying to figure that out. I only have the accounting data system to pull my data from. So it's always going to be on payment date, and that's really all I can work with. So this was claims that were paid through the end of state fiscal year 2020.
And I'm sorry, not to beat it there. Did you create this file recently, or did you create this report closer to June 30th?
I created this file after the year end was closed in the accounting system. So it has all the data through June 30th, 2020.
Very good. All right. Oh, all paid claims. Got it. Thank you.
Yeah. So I think there was only one other item I wanted to point out for you, and this is more as a reference point for this file, because I've been creating this particular page. So this is page 8 of your packet. And what this file is trying to do is show what the expenditures looked like year over year if you take out the Medicaid expansion. Because we know that in state fiscal year 19, we only had what amounted to 4 months worth at most of Medicaid expansion claims to really include, where state fiscal year 2020, we had the whole year. So for the sake of the work that I do on this document, I wanted to take the Medicaid expansion claims out and just show what the claims were outside of that year over year. And so with Medicaid expansion claims, the increase year over year of expenditures was about 9%. If you took Medicaid expansion claims out, the year over year increase was 0.7%. So that tells you that almost all of the increase that occurred in the year was due to Medicaid expansion. So that's just something that I was doing basically to make sure I could keep on top of the number and make sure that I knew what impact Medicaid expansion was having on the totals. Any other questions on that expenditure file before I move on to some caseload discussion?
I think Representative Millet has a question.
Thank you, Mr. Chair. I think you promised that you'll give us more commentary on the effect of the FMAP improvements. So to the point you just made, Luke, that 0.7% increase in expenditures, all funds, does that take into account the increased federal share of FMAP?
I'm sorry, I think I'm having some internet issues over here, and I didn't quite hear the whole question.
Okay, I was looking at table on page 8 and the 0.7% increase in non-Medicaid expansion expenditures through June 30. Does the effect of the FMAP percentage increase due to COVID make that growth from 19 to 20 a little bit misleading? In other words, how much would the total expenditures include increased FMAP funding that came about in the spring of 20?
It definitely would have an impact because that began when the emergency began. I don't remember exactly which date that goes back to now, but the 6.2% increase definitely would lower the general fund impact. I would note, though, that the number you're looking at there, the 0.7%, that is all funds. So whether it's a general fund cost or a federal fund cost doesn't matter in that particular percentage, because that percentage is just, here's the total cost of main care expenditures. And that doesn't change by the FMAP. The only thing that changes is the portion that's paid by the general fund.
Thank you.
All right, if there's nothing else, I'm going to move on to part C, beginning on page 10. This is the caseload file, which I send to you monthly. Again, I received this from the department directly, and I highlighted the final two, the second to last two columns of this file. What those show you are the total caseload on a certain given month, and it shows the change from the previous month. So there's a couple things I want to point out here. First, if you look at January 1st, 2019, you can see the first sizable increase. And of course, that was due to the Medicaid expansion. You can see it increased 3,369 folks. And if you look at the column just before the two highlighted columns, that's the Medicaid expansion column. That has how many were specifically Medicaid expansion. And of those 3,300 folks, 2,900 of them were Medicaid expansion. So from January of 2019 through August of 2019, there was a very sizable increase almost every month, largely due to the increase in the Medicaid expansion population. The increase slowed down at that point in August of 2019, and we started getting to a point where it was about 1,600 a month for 6 months. That's about how many were coming in each month. Then COVID came along, and if you look at the March 2020 line, which is the fourth line from the bottom, you'll see that there is a pretty sizable increase in March, and that continues through June. Of the increases that you're seeing there it's not all due to COVID, I'm sure, but it is definitely increased largely due to COVID. Of this increase, the thing I've been pointing out to you in my monthly email is that about 40% of the people joining are going in the Medicaid expansion population. The other 60% are basically going in the traditional Medicaid population. That's only important to point out because those 40% that are coming in get the increased FMAP. And so that's just, it's important to know where the people are going when you're trying to figure out how it's going to impact expenditures. Are there any?
Sorry, to make sure,
Yeah.
because again, so people who are coming in under expansion are still getting the 90% FMAP. People who are coming in traditional are getting the 6.8% though increased FMAP.
So the regular FMAP plus 6.2%.
Right.
Yep. Are there any other questions on that
So
file?
these numbers are current up to June 1st. So we
Yes.
don't really know like whether this experience has continued over the last couple of months, although there's no reason to suspect that it
Correct.
hasn't.
And I looked back and I actually haven't received the July file yet. The caseload file is rather delayed in getting the data and then getting the data to me. And so I haven't received the July file yet, so I don't know exactly what happened in July. So I don't know if, for instance, if you look at May and June, the increase went down quite a bit. And I don't know if in July we're going to see it go down more or if it's going to jump back up again. So I don't have more data than what's here on this document.
But even after, so this represents a year and a half of enrollment in Medicaid expansion, including the first 2 or 3 months of the pandemic. And we're still not at the amount of enrollment that we originally projected that we would have when we move forward with that. Is that fair to say?
Yes. You can see the enrollment has continued to go up, but again, because of COVID, it sort of impacts how I can look at that number, because it's hard to know how much of it is the regular continuation of what was the old rules and an additional increase due to COVID. It's hard for me to be able to pick that apart in any way.
Great, thank you. Representative Keschel has his hand up. I'm sorry, Representative. You've probably been waving at me for a few minutes.
Oh, no, not really. I was just looking at those change numbers, and if you look at the previous year, that same period of time, compare it to this period of time in 2020 with COVID, the change numbers seem pretty much the same. I wonder if you go back in history and were to look at the January through June data, whether there'd be an increase in terms of the change numbers, similar, perhaps due to seasonal flu and colds.
I will say, looking back, there's always so many changes that seem to occur in every budget and every session that impact Medicaid that it's hard to just compare year over year and assume it's the same. When I do this, the file you're looking at here, it's 24 months worth of data. I do have data going back further than that, and I do look at it just to see some comparisons like that. But I will say that there was no doubt that when this increase started in January 2019, it was fully related to what we would have expected because of Medicaid expansion. And we saw that number going up pretty quickly. And then we saw, as I said, in August 2019, it started to kind of level off. And so we were on a path where I had some idea of what was going on. I could see if something changed, but then COVID happened, and now it's throwing a whole wrench in the system because it's a lot harder to pick apart the data because now it's including a whole nother item.
I get that, but I was just wondering whether there's a seasonal increase in terms of the change number. That's all I was getting at.
Yeah, and I guess I just haven't.
Change numbers, and whether that seasonal influence, perhaps those cases weren't really attributable to COVID.
I don't know that there's a seasonal influence on caseload. I don't know that I've seen that. I do know that back when I was with the department and saw claims data and was able to pick that stuff apart, there was definitely a seasonality to the way claims came in. That was something you always saw, but I don't know about there being that sort of impact with caseload.
Okay, thank you. Appreciate that response.
So then the next page, page 12, I'll just quickly note what this is. This is the same data that I just referred to, but broken down into additional groupings. So it just has more detail. It's in the file that I send you every month, so you can always see this information. But I just wanted to put it in front of you here so you can see how it relates to that summary document that I just went through. So the last document I'm going to walk through, Part D, this is another caseload file. This is the one that I create each quarter and put on the other fiscal information website. This one is through the end of state fiscal year 2020. And the information here largely runs in line with what I just went through because I'm using the same data. I use that DHHS caseload file because that's the only information I have on caseload. But I did break it down a little bit here just to note that the caseload was decreasing prior to Medicaid expansion. That was one thing that had been going on for quite a while, was there was a steady, slow decrease in the caseload. And then January 2019, it jumped up. But in the fourth quarter of state fiscal year 2020, the caseload increased by a pretty large amount, 17,320 people, which was an average of 5,773 members a month. That is much greater of an increase, as I said before, than the September through February, the previous 6 months, which were averaging an increase of about 1,600. So as I said, that's likely.
Oh, I think you
The
froze
biggest
there.
reason we have such a large increase.
Luke, you froze right there.
Oh, okay. Sorry.
You're about to give us your stunning conclusion. You said it was likely, and then.
So that increase was likely related to new members entering the program because of COVID. We can't be very specific about that, or I certainly can't be with the data I have, but that's big of an increase is likely due to COVID. The last 2 pages are just additional charts and information based off the same data we've just gone through. So I won't get into detail on those, but they're up every single quarter if you ever want to take a look at them again. And that's really all I have, if there are any questions.
Thank you. Let me look around and see if there are any questions. Representative Jorgensen.
Thank you very much. I really appreciated this analysis. I'm curious about the, when you talk about people entering as a result of COVID, do you think that's mostly a result of people losing their jobs and therefore their insurance and therefore becoming credit eligible for this? Or do you think it's they get sick and they need some way to pay for it? Or what is your sense of that? Do you have any, is there any sense of that?
I don't want to get too much into what my sense of it may be. What I'll say is that it is likely due to loss of job, because that would then lead to someone having the income level that allows them to get into main care. I don't know that even the department would have good information to answer a question like that, just because if the people don't come through the door to sign up, we don't know why they're not signing up. But once they come in, if they're eligible, they get on the program. So I think it's a bit of a hard question to answer, because it's trying to answer what you don't know.
Representative Ketchel, your hand is still up. I don't know if that's from the last question or not.
It was from the last question. I'll remove it. I forgot.
Very good. Thank you very much. I don't see any other questions. Luke, I'm really glad that I brought my reading glasses today. Again, Senator Breen and I figured that with all that's going to be facing this committee over the next few months and into the next year, that we get this report periodically. We haven't really sat down and done a deep dive into it, and I really appreciate you sort of reorientating us. Forget it. To these spreadsheets, and thank you for that very clear explanation.
Very welcome.
And I think that's a good transition. I don't see the people from the department on specifically. I see Molly's here. Molly, are Ben and Michelle with you?
They're not with me, but they're in a conference room in DHHS. Their video is called DHHS.
Oh, I see them.
There we go.
Good morning.
Good morning.
Good morning. So I'm just going to turn. It looks like you sent us some information. I'm just going to sort of turn it over to you, and maybe you want to walk through some of these slides that you provided us with. Was that a good way to start?
It is. So we will start with introductions. Good morning.
That's a good
everybody.
idea.
My name is Michelle Probert. I am the director for Maine Care, which is Maine's Medicaid program.
Good morning, everyone. Thanks for having us this morning. I'm Benjamin Mann. I'm the Deputy Commissioner of Finance at the Department of Health and Human Services.
And Ben and I will be going back and forth through this presentation. And I will start off. So first, I always like to level set, take a step back, and provide a reminder that MaineCare, as I said before, is Maine's Medicaid program. Medicaid is a program nationally that provides health insurance to low-income individuals, and in the state of Maine, helps Mainers get critical services, to name a few, like preventive care, inpatient care, substance use treatment, and long-term care. And I think that it's true, likely for all Americans, that we have a new appreciation of the Medicaid program during the COVID-19 pandemic, as it has been so critical, not just to help individuals get testing and treatment related to COVID, but also to make sure that that folks stay up on their preventive services. And we all know the relationship at this point between chronic conditions and severity of COVID cases. And so it's really one of the critical foundations that we have in the country and in the state of Maine right now to protect against this pandemic. I am going to start off by talking a bit about MaineCare's response to the pandemic, and then we'll look to Ben to talk about the financial aspect of that response. So immediately under COVID-19, our attention first went to members and making sure that members had appropriate access to care, and also that they could remain safe during the pandemic. And so starting on slide 2 of the presentation that we provided, you can see that we immediately made sure that members had access to testing, diagnostic, and treatment services, and not just for our regular MaineCare population, and I include expansion in that group, but also for our emergency MaineCare program, which provides limited care for individuals who aren't eligible for full MaineCare and may have, for example, undocumented status. And so we made sure that population in this state also could have access to testing and diagnostic and treatment services. We also took advantage of an opportunity provided by the federal government to be able to specifically provide testing and related services to individuals who did not otherwise have insurance, regardless of their actual income level. And that has been an important service as well. So that's on the coverage side. In addition, as I said, we wanted to make sure people could stay safe at home. And part of that was especially when our healthcare system had largely hunkered down and we weren't all going into regular care visits, we extended prior authorizations. We made sure that people had prescriptions for enough days so they didn't have to make repeat trips to the pharmacy. In order to lower any financial barriers, we've waived co-pays. I will get into this a little bit more later on, but telehealth has really been a silver lining of the pandemic as a whole, and a very important way for MaineCare members and for all of us in Maine to continue to receive care. So we conducted an outreach campaign to actually at the request of some providers to help make sure that Mainers were comfortable with the idea of telehealth, knew that it was accepted by the medical establishment and that it was a safe option for them during this time. In addition, we conducted an outreach campaign in collaboration with the Department of Labor to make sure that people who had lost employment during the pandemic were aware of MaineCare as an option to make sure that they were able to continue their health insurance coverage. And then lastly, just in terms of member access, I'll mention that we're trying to make it easier for individuals to receive home health care services and personal support services in general. These are always a great option. We know that older Mainers prefer to stay in their home, but again, especially during the pandemic, allowing individuals who are more at risk of COVID to receive care in the home is preferential to traveling to different doctor appointments. And so we are now allowing across the board, and this will actually be a permanent change, to allow mid-level professionals to certify and authorize home health. Previously, at a national level, it used to be that you needed a physician to authorize home health and personal support services, and now that is no longer the case. So those are some of our efforts that had direct member impact. Obviously, all of the work that we do at Main Care ultimately serves the member, and so that is our first priority. On slide 3, you will see that we've taken a lot of actions intended to stabilize and support our provider community as well, because they're the ones who are clearly directly serving our members. As I'm sure you are aware, providers have faced a very difficult time during the pandemic. They have faced many increased costs, including personal protective equipment. There have been staffing challenges because both of the need for more staff and also because of staff illnesses and the responsibilities that staff have to care for their own family members and also to isolate when they're not feeling well or when their family is not feeling well. There have been costs related to the need for redesigning space to ensure safe social distancing when patients started coming back into the office in person for care once again. And then again, there's been a transition to telehealth and making sure that providers were set up properly to be able to have those safe and confidential telehealth interactions with patients as well. In addition to the increased costs, providers were also faced with decreased revenue. Not just on the Main Care side, but across the board. And that is clearly a result of individuals foregoing, we hope in most cases, care that could be put off safely for a period of time. But we all also have a concern that some individuals put off care that really shouldn't have been put off. And we can see that when we look at trends in emergency department use, for example. But the decreased revenue, we know, is a hit to providers and impacts their ability to continue to serve patients. And I will just especially call out that for some of our Medicaid providers that don't really have a robust patient base from other payers, they could especially feel the brunt of that impact. So what have we done to support things from the provider perspective? Our financial supports initially focused on those providers who were serving individuals who had COVID-19 or were at very high risk of COVID-19. And so Ben is going to get into some of the numbers, but that included supplemental payment one time to the hospitals. It included temporary rate increases for our congregate care facilities, as well as looking at our members who receive home and community-based services, many of whom who are in group home settings who are also at risk. And we also know that individuals with intellectual and developmental disabilities are at higher risk of COVID in general. So that was really the focus of our first tranche of support. And then as the pandemic wore on, we started looking at those services that we know are so important for our kids and for our population with behavioral health needs, preventive services, as well as behavioral health services that really had taken a huge hit. We saw some of our biggest declines in service utilization amongst children. And then we also saw big declines, not across the board, but certainly in some services around behavioral health. And we wanted to provide supports that helped providers cover some of these costs, but that also served a dual function of helping to incent and encourage providers to re-engage with members, provide support to outreach those members, and whether through telehealth or through safe in-person care, to get those folks receiving those critical services again. So we targeted the behavioral health services that were really hardest hit. Those included school-based services. And then recently we've provided child health incentive payments, which are kind of neat because we specifically look for members who have received both children who've received both a wellness visit and an immunization. And if they've received both of those important services, then the provider will get a per member per month payment for that member in order to make sure that kids are getting immunized and back into the office. So that is on the payment side. Again, we will go into more detail on that. Also, just in terms of service delivery more broadly, we've simplified our process for provider enrollment during the pandemic. We have engaged a lot with providers, both virtually in meetings like this and also through written guidance around telehealth and creating more flexibilities there. We've allowed services to be provided in alternate settings. And we've also allowed, for example, congregate care facilities to have some joint isolation units for COVID, which otherwise could get kind of complicated from a financial perspective, but we work together to find ways to allow for that, since it's clearly in the best interest of patients as well as staff at those facilities. And next, I'll look to Ben, and we are on slide 4 currently.
Great, thanks, Michelle. So looking at slide 4, this is the financial response that we've taken through main care. And just to start off with, I wanted to reiterate something that Michelle just said. I think these payment supports that have gone out to providers have been, we work closely with the providers themselves to develop these rates and the supports in place so that and besides that, we've worked with them closely. We have had regular meetings with numerous stakeholder groups since March and the beginning of the pandemic on financial issues, but also operational issues, licensing issues, policy issues, and it's been a strong collaboration between us and our stakeholder groups and provider communities. So I will just run through in a little bit more detail with some numbers of what Michelle mentioned in terms of our financial response. You can see the first is the one-time hospital supplemental payment of $10 million all funds. And just to orient you to the slide, there's an all funds column and the state share column. These were all done through main care. So there's a state share and then all funds. That was pushed out to hospitals in April. Next, it was nearly $13 million to home and community-based providers, the waiver programs. That was done through a temporary rate increase of 10%. And that also, that authority came through what's called an Appendix K, which also afforded other flexibilities for providers, particularly on the staffing side, which has been beneficial for them. And the temporary rate increase is no longer in place, but a lot of those other benefits, especially on the staffing side, still continue today. I'll go down to congregate care. Taken together, it's nearly $20 million total to congregate care facilities. That's nearly $9 million all funds to nursing facilities, and then $11 million to PNMIs and ICFs. That was done through a temporary rate increase as well. That varied from provider group to provider group, exactly on the rate. That is also was provided from March through June. Was allowable costs were allowed through June. As we know, as the pandemic is worn on, we're acutely aware that the virus does not affect all facilities in the same manner. You might be spared some of the costs or revenue decreases depending on where you are located in the state, or just by happenstance or stronger infection control procedures. And because of that, we've stood up the COVID congregate care outbreak rate. This is an ongoing rate that's in place today. So for any facility that any congregate care facility that suffers an outbreak, which is defined as 3 or more epidemiologically linked cases, there's a temporary rate increase that kicks in on the first day of the pandemic, and it continues till 28 days after the last case. So in many cases, while it's obviously unfortunate that facilities need to deal with the pandemic, with the outbreak, and has significant consequences for on their financial side of the house, there is that temporary rate increase that's in place and continues on for nearly a month after their last case. Michelle spoke about the behavioral health incentive payments and the child health incentive payments. You can see the cost or the funding that was provided. These were done later in the year, and those payments are still going out today. And the final thing here on the slide is the early implementation of some rate increases. Recall back in the supplemental budget that was passed in March, there was several rates that were increased, slated to go into effect on July 1. We accelerated those rate increases, most notably for personal support services, but also some other behavioral health services like med management, to make them go into effect on April 1. There was one that went into effect on May 1, but that pushed out another $6.1 million to providers in advance of those rates kicking in on 7/1. So in total, the state through Medicaid has provided over $57 million, and that's ongoing due to the outbreak rates. It's not represented on this slide, but there's other benefits to providers as well, notably nursing facilities. Due to the testing capacity that we've built out at the state lab, CMS has a requirement that nursing facility staff be tested on a regular basis, at least monthly, and we are covering those. We've given the option to nursing facilities for sending samples to the state lab for testing, and that it's difficult to estimate exactly, but that's probably a benefit of $500,000 to $1 million for every round of tests that come in across the state from nursing facilities to the state lab. So we'll go to
Deputy Commissioner, can I just interrupt you for 1 second? Senator Breen had a question on this slide.
Thank you, Mr. Chair. Before we leave this slide, I just wanted to focus for a second on the temporary rate increases. And I'm trying to figure out, or I'd like to hear from you, was that something that the CMS initiated, or was it something the state initiated? And what was the rationale for having it temporary for those particular months?
So I will speak more broadly about federal authority. So under 1135 waiver that CMS has, it's frankly generally been used for things like hurricanes and natural disasters that have a pretty limited time period. But that is the authority that we're taking advantage of during the pandemic to provide some more flexibility. And CMS provided a specific template for states to be able to ask for, amongst other things, payment flexibility during the pandemic. And so we're able to get that through more quickly and easily than we would otherwise be able to do. So CMS at a national level has had no directive to states about doing temporary rate increases, et cetera, but they've provided additional flexibility. And we have taken advantage of that flexibility. Ben, do you want to talk about the second part of the question?
Sure. So when we put those in place, yeah, we had some capacity to and the authority to put it in place through existing policy, and had to seek out other policies for that authority. We didn't, we were taking this there's a lot of uncertainty, so we wanted to put that in place. We actually did extend the period for allowable costs in several instances through the end of June. We do need to just be mindful of costs overall, and there are other, as we'll see on the next slide, there are other sources of funding available to many of these providers that they can seek out. I also note that some of these rate supports are in place still, like the outbreak rate and the ongoing rate increases for some of those services. I'd also note that the temporary rate increases, like I said, it's a very facility by facility, provider by provider impact from the pandemic. We've had some providers actually choose not to take the temporary rate increases because they thought they would likely have to just pay them back because they weren't intending to or planning on using it.
So do you think the time frame was the most you could leverage under existing policies? Is that a fair statement?
Yeah, I think the temporary rate increases were intended not for revenue loss, but for COVID-related costs. And those COVID-related costs were able to be borne, and likely they would be front-loaded in the start of the pandemic. And so I think we extended, they went away in June 30th for most of them. And there's other abilities to backfill costs related to COVID response. And like I said, that there's still several flexibilities on the Appendix K for waiver providers still in place. The outbreak rate is still in place, and those for 2 examples there as well.
And I'll just
Okay,
speak to
sorry, go ahead, Michelle.
I'll speak to the behavioral health payment supports. Those were in place for 2 months. I'll say that another factor with those is that we were very closely watching utilization trends in specific community behavioral health services. So as claims continued to come in, we were literally updating that analysis on a week-by-week basis. And our determination of which services should get the rates, as well as the period of time we looked at, took into account how quickly those services were getting back up to a more normal or close to normal utilization. And we'll see a couple examples of that as we go further on in the deck.
Okay, thank you.
Representative Purse, I'm sorry, Representative Purse, you have a question on this section?
Yeah, I do, and one on the previous one, if that's okay. So I just want to make sure I'm reading the chart correctly. So if we take the hospital supplemental payment, 10 million and 3, a total of 13, or is the 3 within the 10?
The 3 is within the 10.
Thank you. I want to make sure I understood that correctly. And then I don't know if you're going to get this to this at a later point, Director, but you alluded to you might keep some things in place that were beneficial going forward that you did in reaction to the pandemic on one of the earlier slides. I would love to hear more articulated what those things might be, either now or at the end of your presentation, whenever is appropriate.
Certainly. I think let's get through the rest of it. It might also, just because I don't have a comprehensive list in my head, it might be one of those things that we can coordinate with Molly to get back a comprehensive list to make sure I don't miss anything off the top of my head.
Thank you.
Okay, Deputy Commissioner, it's all yours.
Great. So turning to slide 5, we just covered the state funding part, but that's only a part of the overall financial picture. There's, as I think folks are generally aware, federal funding has come through 2 main pieces of legislation at the through Congress at the CARES Act, which was passed in March, and then the Paycheck Protection Program and Healthcare Enhancement Act, which was basically replenished the PPP, and that was passed in April. I note that a lot of these funds, I'm sort of an observer of them. They went directly from the federal government to providers directly, not through the state or the department. But this slide does provide us an additional fuller picture of the funding that's available to healthcare providers during the pandemic and still ongoing to some degree. I'll just, there's 4 main buckets here. The first one is the Provider Relief Fund. That was, Congress appropriated $175 billion for that. The first general distribution, phase one, went out at 50 billion, 145 million to main providers. That was based on Medicare billing. So if you had billed Medicare in 2018, that they used that as a methodology to push funding out. The majority of that funding went to hospitals and nursing facilities, as you might imagine. The second distribution, which is not all healthcare providers by far bill Medicare to the same degree. So they've made 18 billion available for Medicaid providers, and that was an application that closed earlier this month. And that funding will still be pushed out later this year. I'm not sure the exact timing, but that's they're trying to capture a fuller picture of healthcare providers that might not bill Medicare through that mechanism. The targeted distributions, you can see the funding there. That was based on, there was 251 million or so that went to hospitals and nursing facilities, primarily through a rural distribution push to hospitals and rural health clinics, to a hotspot distribution that went to the Cumberland County area for hospitals, and there was also a safety net hospital distribution through that. I'll just note that there's at least 50, it's hard to count exactly, but it's probably closer to 60 actually, $60 billion remaining in this unallocated and undispersed. I know that there's of that 50 billion, I know at least they haven't announced a lot of how that will be distributed, but 2.5 billion will be going back out to nursing facilities this fall, based on which will be, the methodology will be based something that they haven't used in the past, but based on performance of the nursing facilities themselves. That's the only thing I've read on that. That's just a quick overview of the provider relief fund that was available through those two pieces of legislation. The Paycheck Protection Program is obviously available to any main businesses, or generally available to any main businesses with fewer than 500 employees. That was open to healthcare providers as well. There's an existing FEMA reimbursement through their disaster mechanism for COVID-related costs during the pandemic. That's open to private nonprofits. For-profit organizations can't apply for that, but nonprofits can. And that's a reimbursement of 75% of COVID-related costs. And the state actually set up a fund to pay for the balance of the 25% for nonprofits as well. And the final piece here is the Economic Recovery Grant Program of $200 million that was done with Coronavirus Relief Fund, the CRF, that was allocated to the state. That was announced for any providers with fewer than 250 employees, and hospitals and nursing facilities are not eligible for that. And I know Commissioner Johnson will be before you later today, and I'm sure she'll be happy to answer questions related to that.
Just once, I'm sure she will, but I'm going to ask you a couple questions anyway. Thank you. With respect to the Paycheck Protection Program, do we have any insights, or are we able to track the extent to which, DHHS providers, whether main care or not, have accessed that program and the amount of benefit? Is that something the department has the ability to look at as it's evaluating the overall situation with respect to providers?
Yeah, it's a good question. The data is actually all public. It is enormous, as you can imagine. It's all publicly available on the HHS SBA website, but it's hard to disaggregate it to go through for everything. So we've worked with some of the associations out there to try to determine that. I don't have it at my fingertips right now, but happy to follow up about that.
Great. And I assume with respect to the Economic Recovery Grant Program, I mean, if you have insights at this point, it would be helpful to know, but do you know whether, again, DHHS providers have been trying to take advantage of that?
I know, so they just raised the limit from 50 employees or fewer to 250, and that was done on Monday, I believe. And I don't have a good understanding. I know that it was open, and I looked at the data briefly, and there were providers that were availing themselves of that, and I would anticipate with the increased size of eligible applicants that'll capture a lot more providers going forward under the current application period.
And we have been trying to help get the word out to make sure that eligible providers with DHHS certainly do apply.
So as providers contact you, Director, the department sort of reminds them that that money might be, or that relief might be available to them. Is that what you're saying?
Yeah, the different offices have been communicating with their providers and associations to make sure they're aware.
Yeah, we've been encouraging them to apply for that, as well as back to the provider relief fund. The general distribution phase 2 was an application-based process, not a push from HHS. So we were held some webinars to answer any questions that providers might have for that as well.
Very good. Thank you. Okay.
Good. So we'll jump into some more of the just trend analysis of what's going on with Maine Care. I'll turn it back over to Michelle.
Great. So we are on slide 6, talking about enrollment, and this is a graphical representation of some of what Luke was speaking to earlier. So there's 3 main lines on this slide, and just to orient you, the bottom line, which is the lighter blue, represents a trend in our expansion population. The middle line are our Maine Care members who are age blind or disabled. And then the top line is our traditional Maine Care who are not age blind and disabled or part of the expansion population. I do want to note that looking at the expansion line at the bottom, the reason why the line ticks up starting in January is this reflects when individuals were enrolled. As you're likely aware, enrollment is able to go retroactive and went retroactive back to July 1st, 2018. But because this is showing actual enrollment date, it's not showing when someone was eligible. So I wanted to make sure that that was clear. With expansion, just since the number isn't on here, the most up-to-date number that I have from yesterday is that we are currently serving 62,684 members under expansion. And another number, which is important to note, is that in terms of number of Mainers who have benefited at some point from expansion since we expanded, regardless of whether they're currently on the program, we have served about 84,000 total Mainers through expansion overall. Again, that number is not point in time, but looking back, who has benefited at some point. So you have to look pretty closely at the bottom line, but you can see that we were growing at a fairly good clip. As Luke had mentioned, we started to see a slight flattening of that curve that frankly happened once individuals had been on expansion for a year. They have to submit more paperwork to show that they're eligible. And sometimes that doesn't happen quite when it should. Sometimes they're no longer eligible when they do submit that paperwork. And so we kind of naturally saw a bit of a flattening of the trend as that recertification process started to come up after a year. You can see, not surprisingly, corresponding with the start of the pandemic, that the curve started to get a little bit steeper again and has remained so since the beginning of the pandemic. In my head, that's really due to 3 factors. One is that we have been projecting, and we're projecting prior to the pandemic, that growth under expansion would continue. So that is a piece of it. Another piece of it is, of course, that we have seen unemployment go up, and it's been well demonstrated nationally that as unemployment goes up, we expect to see Medicaid enrollment go up. So that has been a component as well. And then I also wanted to note that along with the enhanced FMAP that we've gotten during the pandemic, CMS has what we call a maintenance of effort requirement that says that in order to get that enhanced FMAP, you actually cannot drop people from the program. So I noted that we had initially, after a year of expansion, started to see a bit of a slower enrollment growth rate as people had to reestablish their eligibility. We are not seeing that negative trend impact anymore, because at the moment, people are not losing their main care eligibility. So that is an important that's an important thing to be aware of in terms of enrollment that is specific to the public health emergency that we are in right now. If you look at slide 7, I think I've talked through a number of these, just looking at the chart. I would also just note that looking at our application volume in general, we can also see that our application volume is higher. As a reminder, the application that we have within DHHS is not just for main care. It's an integrated application where individuals can apply for supplemental nutrition assistance as well as temporary assistance for needy families at the same time that they are applying for main care, but we've seen a higher volume overall. And then the last bullet point there is just to illustrate what I said before, that at a national level, we don't have main specific studies on this, but we can see that for each percentage point increase in unemployment, you tend to see an increase of about 0.77 percentage points for the share of people who are eligible for the Medicaid program.
Director, can I ask you a quick question? So even though the increased FMAP didn't apply to the main care, or I'm sorry, to the expansion population, right? I mean, that's 90% still. The maintenance of effort applies to both traditional main care and the expansion population?
That is correct.
Okay, thank you.
And just as a note, because it's relevant to budget discussions in general, it does not just apply to eligibility and enrollment in the program, it also applies to services. So we, for example, and some of this is due to interpretation, it's not all written out, but there's a concern that if you, for example, said there's going to be new prior authorization requirements for a service, that could be seen as a restriction of a service and potentially not allowable under maintenance of effort. And most certainly, if you said, we're not going to provide this entire service anymore, that would clearly be a restriction and a cutback, and that would not be allowable during the public health emergency either, in order to retain that enhanced FMAP.
So let me understand that again, because I think that's important. So, as we look at the approach that the executive branch is taking towards curtailment, what we're hearing is that, there is not a reduction in services that we're able to, the strategy around curtailment does not involve curtailing any services or changing any benefits. Are you saying that because of the maintenance of effort provision, that if there was a change in benefit or a reduction in some of the benefits in main care, that would put the additional FMAP at risk? Is that?
During the public health emergency, okay. That is correct. And then we'll get into some other sources of uncertainty and volatility later on in the presentation. But yes, that's correct. During the public health emergency, which is currently set to expire on October 23rd, I believe. Our hope, of course, is that it will be extended yet again, but we certainly cannot guarantee that.
Thank you.
I would, just a transactional matter, sort of, I have the data for the July enrollment, like that Luke was presenting earlier, and it was basically 4,500 new enrollees in July on top of that. So that trend is basically continuing on.
Great. Okay, thank you.
Certainly.
We're running a little behind schedule, but I do want you guys to finish up this presentation. I know we've interrupted you a couple times with questions, and we'll probably still do that. But why don't we just plow ahead? Thank you.
Okay. So looking at slide 8, speaking of some of the initiatives that are already happening or about to happen for this year, and some of these should be familiar to you. So first, for our home and community-based waivers, we are required by CMS to renew those waivers about every 5 years, and our waiver programs for individuals with acquired brain injury and other related conditions, those are sections 18 and 20 in main care policy. Those services were up for renewal, and CMS takes, especially over the past couple of years, they have started to take a much harder look at what our rates are and also what our rate methodologies are for those waiver services. And so we conducted a rate study this last fiscal year for sections 18 and 20 to go along with a waiver renewal for those services. We also have services that are essentially the same services, but for a population with intellectual and developmental disabilities under sections 21 and 29. And in order to be consistent, we said, well, since they're the same services, we should apply the same rates, even though they're under different waiver programs. So we've implemented and are implementing rate changes for sections 18 and 20, and then for sections 21 and 29, which are the home and community-based waivers for intellectual and developmental disabilities. For the services that overlap between those, we are implementing the new rates for 21 and 29 there as well. I will skip nursing facilities just for a moment to say, as Ben has noted earlier, we also put into place rate increases for personal support services. There was a concern that those rates were not adequate to support minimum wages, and so we did an analysis to make sure that the rates were adequate to support appropriate wages for those services, and those were some of the rate increases that we ended up implementing early, in part because of the pandemic, and we felt that support was important to get out. And then lastly, there are certain children's behavioral health services that have been recognized at a national level as being very effective evidence-based services, and we wanted to encourage more providers of those services. So also conducted a rate study for those services and implemented those rates. And that includes the multisystemic therapy as well as trauma-focused therapy. And I might have gotten those names wrong because I struggle with the acronyms, but I can follow up if you need more detail than that. And then lastly, for our nursing facilities and our residential care facilities, they do receive, as you're aware, a cost of living increase, supplemental wage allowance and rebasing, and that is happening for FY21 as well. And Ben has a bit more detail on that front to share.
Yeah, just to clarify, we don't rebase RCFs, just the nursing facilities. It's a little, I just wanted to make that clarification on that. And since it's a frequent topic of conversation, I just wanted to provide a quick summary of recent reimbursement increases for nursing facilities. So just starting in fiscal 19 to fiscal 20 to fiscal 21, LD 925 in fiscal 19 provided a one-time 10% supplemental wage allowance that was worth $17 million. In 2020, there was a cost of living adjustment, which was about $6.5 million. And then we put in place a prospective secondary cost of living adjustment to make sure that the rates didn't fall due to the fact that the LD 925 supplemental wage allowance was one time. And that COLA was worth around $10 million. And then LD 1758 also passed, which provided a second supplemental wage allowance, which went into effect in fiscal 20, which was $11 million. And in the current fiscal year, like we just talked about, there's a COLA and rebasing for nursing facilities, which is around $21 million. And the second year of the second year of the second supplemental wage allowance through 1758 for 11 million. So that totals $77 million all funds over those last 3 years for to support our nursing facilities, who have certainly been on the this is outside of the pandemic, but they have been on the front lines of response for of the pandemic since March, obviously.
Deputy Commissioner, actually, if at some point you could send around to us and maybe members of the HHS committee that information in some kind of a chart or a spreadsheet or something, I think that it'd be easier for us to track if we could look at it in black and white. So
Certainly.
thank you. I'm looking around for quick questions before we move to the next section of it, because I have a quick question for Director Probert. Michelle, when you were here probably in the late winter, early spring, we talked at length one day about a comprehensive review of the department's rate methodologies that the department was moving forward with over the summer and the fall. I'd love to get a really brief update on where that stands, because I know people are interested. Also, again, really quickly, because I'm a little bit concerned about time, is I understand that there's been some developments in Washington around the MFAR issue that you brought up to us last year, and I'm wondering if you could just highlight that for us really quickly.
Sure. So both of those items are part of our planned presentation. Did you want us to address that now or just?
No. If it's in here somewhere, why don't we just take it up when we get to it? Sorry.
Okay, sounds great. No problem. All right. Shall I proceed?
Yes, please.
Okay. So the next number of slides show a little bit of a snapshot of utilization trends before and during the pandemic. We had a lot more of these slides, which I think are fascinating, but didn't want to take up too much of your time, so pulled out a few that we found particularly interesting. The first slide, on slide 9, is hospital utilization trends. I first want to point out that usually we show you trends and information based on claims data. The exciting thing about this slide is that it is actually based on electronic health record data. We, as Maine Care, have access to Health InfoNet, and the electronic health record data does not have nearly the same kind of lag that we see in claims, because claims has to go through billing and everything else. There's a bit of a lag with electronic health record data, and that is why on this hospital slide, you will see a checked line, and that is actually the line you want to look at, because once everything is up to date in the health records, that is what we expect to see. The solid line is what's observed at this point, but again, we expect that checked line to become solid as we move over time. So this will be a repeat pattern, but you can see that hospital inpatient utilization really fell steeply in March and started to come back a bit, especially in May, to coincide with our reopening at the state level of services and elective procedures in particular. And at the moment, again, looking at that dotted line, we are about up to normal with our inpatient hospitalization, and that is consistent with what the Hospital Association has shared with us on a multi-payer basis as well. The next slide is a slide I'm very proud of. Maine Care is considered to really have been for a while on the cutting edge of telehealth policy. We have regarded telehealth as a way to deliver services, not as a service in and of itself. And starting back in 2016, so I cannot take any credit, but starting back in 2016, we provided parity in terms of payment for services delivered via telehealth and services delivered in person. Even though we had a really great and progressive policy for telehealth, hardly anybody was using it anyway, as you can see by the very flat line on the left of slide 10 here. And so we were averaging about 1,000 claims across main care per month where services were delivered via telehealth prior to the pandemic. And then at its height in May, we skyrocketed up to about 90,000 claims per month. And so that is, for those of you keeping track, a 900% increase, which is not something that we usually see in healthcare, and not something that we usually like to see, but in this case, it's been an extremely positive trend. You can see that as individuals have started to receive in-person care again, that we have seen those rates of telehealth utilization start to trend back down. But we do not anticipate that it will go back down to previous levels ever, and we don't want it to, because aside from the great value of telehealth during a pandemic, we have for a long time been talking about how critical telehealth, a critical role telehealth plays in Maine as a rural state where we don't have the same level of access to services across the state. And so we've also heard really encouraging reports from providers that in some instances, they've found that engagement with patients has improved or increased under telehealth. It's obviously not uniform across all services, but it's been a very heartening story to tell. And the next slide, slide 11, shows a couple of charts where you can see pretty different impacts of telehealth, and also this slide shows how different behavioral health services have been differently impacted under COVID-19. So on the left, we are looking at medication management services to adults. And if you look at the dashed line, that is what happened to in-person services. And so in-person services for medication management dropped off extremely dramatically during the pandemic. But the solid orange line at the top really stayed consistent, and that is the total services with telehealth. So in the case of medication management specifically, telehealth pretty much completely filled the gap and enabled continued consistent access of that important service for main care members. So really a success story there. On the right side, and this came up earlier in the presentation, is section 28, which is rehabilitative services under behavioral health. And a lot of these services are our school-based services. So Senator Green was speaking to this earlier. Again, we see a dramatic decrease. You can see that there was some use of telehealth that was helpful to a certain degree, but we're talking about kids. We're talking about kids who have oftentimes serious behavioral health needs. And I think that many of us with school-aged children have witnessed questionable success with kids who may not have any behavioral health issues engaging with a screen on a regular basis. And so it's just a harder population to serve via telehealth than you would see in other services. So section 28 is one of the services that we targeted with our behavioral health incentive payment, which is paid out on a per member per month basis, in part in order to really incentivize providers to re-engage with those members. And I think that this slide really shows success. You can see towards July, which is when those incentive payments went into effect, that we see an upward trend. I will note that usually during the summer, we do see reduced services in section 28 because so many of them are school-based. So this seems to reflect to me that we were successful in getting more kids those services, even during the summer months where ordinarily they wouldn't have the same level of service.
I just add on to that, since it came up in Luke's presentation as well, but looking at Q4 of 2019 compared to Q4 of 2020 suggested it was a 66% decrease in $12 million. You look at it on an annualized basis, school-based services in 2019 was, we paid out $59 million, and in 2020 was $55 million. So just that, I just don't want to give a misleading impression that it was unquestionably an impact here due to the pandemic for school-based services under Section 28. But it's just, I guess my takeaway here would be to dive into the data a little deeper to make sure we see what's going on. I think Luke acknowledged some of the limitations of just looking at counting data. Any questions about utilization, or I'll go on to our penultimate slide here.
No, why don't you go ahead, Deputy Commissioner?
Great. So to summarize a little bit, we've looked at a lot of different dynamics here that are affecting the bottom line of the main care budget. And throughout it, there's a theme of uncertainty. That's certainly still the case today as we look forward in fiscal 21. But I'll start with fiscal 20. As Luke mentioned as well, we ended the year with $132 million in our carrying balance. That is overwhelmingly due to the FMAP increase that was put in place and tied to the declaration of the public health emergency. And we are intending to use 100 million of that 132 million carrying balance to help shore up state budget shortfalls. And that was included in the press release last week from the governor, not explicitly, but it was included in the overall $130 million use of carrying balances. My understanding is will go before the legislature. For the $32 million remaining in the carrying balance in main care, I just wanted to hit on that for a moment. The current projection for costs in fiscal 21, we will need much of that in the current year to cover existing costs. So that is spoken for, so to speak. And also, I think the 32 million is in line with prior year carrying balances as well. We need to keep some money in that account to prevent emergency supplemental budget requests and cycle crashes, especially given just the degree of uncertainty here. I wanted to give you an update on the fiscal 20 end of year balance there, building off of what Luke said before. Looking forward to fiscal 21, there's, like I said, even more uncertainty. We are watching a bunch of different dynamics, the enrollment issues, which are driving up costs, utilization changes, which go in both directions. We are monitoring what will happen with the FMAP increase, which is slated right now to expire at the end of the calendar year. If the public health emergency is extended, will pass December 31st, then we would get another quarter of the FMAP bump. And we are obviously closely monitoring and at the center of a COVID response here from a public health perspective. And that would certainly, if there was a second wave, or as we will work into the winter months here, if there's another surge of COVID, that'll affect our bottom line. And another uncertainty is the service provider tax. Recall last year, we mentioned to this committee that CMS is threatening a disallowance over the state revenue that's generated by the service provider tax. I don't have much more information on that front, but it's a situation that we're monitoring. So with all of that as issues that we're trying to balance as we project the main care budget going forward, we were able to, the curtailment order included $74 million of current year funds, not prior year funds, in that curtailment order. And like you said previously, I think that FMAP contributing to the state budget shortfall is allowing the state not to experience, in part, deep service cuts or program cuts. So that's a good thing. I think I'm happy to answer questions about that. I think we just have one update on the comprehensive rate evaluation that Michelle was going to cover on the next slide.
Then I will also just add that to Representative Boutine's question, that Medicaid fiscal accountability rule. So that rule was withdrawn, which we were happy about. I spoke with you at some length last spring about the potential impact of that rule. I will say that CMS has made it abundantly clear that while they have withdrawn the rule at this point, it is not off the table from their perspective, and we should see a resurrection in some form or another, although certainly how things unfold in Washington may impact that. In terms of the service provider tax, as we had indicated to you in a report, a lot of the items involved in MFAR would have an impact on our potential alternatives to the service provider tax. And so we still need to take that into consideration, even though MFAR for the time being is withdrawn, it is still looming in effect. So it remains real from that perspective.
Could we go on to the final slide of the comprehensive rate system? I think it'll just take a little bit of time.
Yeah, that would be great. Thank you.
I'll turn it back over to Michelle.
And obviously that's good news. That is good news about the MFAR, even though I understand that we're not out of the woods yet, but it was good to see that announcement last week.
Yes. So I spoke with you all at great length about our efforts around our comprehensive rate system evaluation last spring. While our broader context has changed pretty dramatically, I think that it really only makes this effort all the more important. Certainly during the pandemic, the adequacy of rates and the impact of that adequacy on access for members to services is just felt more keenly during this time. In addition to that, I've heard from many providers that our largely fee-for-service based system has been very exposed during this pandemic in terms of the fact that it fails to provide a sustainable payment approach to providers that is flexible and that also focuses on all the things that need to happen to make healthcare high value and efficient and coordinated. That doesn't necessarily mean that your patient is sitting directly in front of you. So in other words, we know that during this pandemic, there's had to be a lot more communication with patients to determine whether or not they should come into the office. There's needs to be a lot of coordination between providers to make sure that care is coordinated. And we don't typically pay for those kinds of activities. And so COVID-19 has really just underscored the need for payment reform. Within the department, we had already established a goal of getting to 40% of main care payments to be under what we call alternative payment methods by the end of 2022, and that remains our goal, and we have to make that commitment. And those alternative payment methods are methods that do provide more flexibility and that do provide a direct tie to the actual outcomes and quality of the service, with a focus on value, meaning the cost for the quality, so that we are moving in the right direction in terms of the quality of care and accountability. So specific to the comprehensive rate system evaluation, how does that play into these goals? First, in terms of the adequacy of our current rates, we are conducting a benchmarking study where we are looking at our current payment rates as well as our current payment methods and comparing those to rates and methods for comparable services, both with other state Medicaid agencies, with Medicare, as well as with commercial insurance. So that benchmarking report is due in October, and we're very much looking forward to it because while it won't tell a full story in terms of adequacy of rates, it will certainly provide extremely helpful context. In addition to the benchmarking report, we are also asking for recommendations, and I should have stated that our selected vendor for this work is Myers and Stauffer, which is a nationally recognized firm that often works with Medicaid around rate issues. So we are also asking them to highlight for us the opportunities where they see for us introducing additional alternative payment methods. And then in addition to that, we will be looking at a prioritization of services. I think that when I last spoke with you, many of us may have made the assumption that at the top of the list would have been services that we felt were in the greatest need of investment. Because of the current budget situation and due to the pandemic, we might need to reframe how we look at this as a potential opportunity for rebalancing. We know that there are main care rates that are probably on the high side when compared to other payers and nationally, and this may be an opportunity to use those funds and redirect them towards services where we can see that the rates may not currently be adequate. Lastly, Myers and Stauffer will be producing recommendations for rationalization and streamlining of our system. I think I've shared with you before that we have lots of different assumptions and methodologies, and many of them are not consistent. And so we feel that there's great room for improvement with our system and look forward to those recommendations. They will provide a work plan and then a cost estimate. It will be a high-level cost estimate. We're basically going to look at rates where we know that we are outliers, either on the high end or the low end, and estimate, what would be the net effect and what we're assuming would likely need to be an investment if we were to try to bring those rates in line with what we see nationally. So the work is currently underway. We are about to start engaging in stakeholder engagement and input. We got underway a little bit late, not surprisingly because of the pandemic. We are asking for a preliminary report with all the recommendations and the costs in December. The final report will come through in February. And as I mentioned, that earlier benchmarking report is due in October.
Thank you. And Director, that time frame hasn't, at least the end of February time, benchmark there, that hasn't changed, or have you? Has the total time frame moved for doing this, or just the work's been squeezed?
The time frame has moved and it's been squeezed. So initially we were hoping for that final report in November. And now the final report won't be coming out till February, but because of that shift, we have asked for a prioritization and to have a preliminary report at least to provide us with some of the critical information in December. So that December preliminary report is new, and it's because we, before we have everything perfect, we want to at least be able to review salient information for decision-making purposes.
And you mentioned stakeholder involvement, and again, I don't want to get too deep into it today, but is there some sort of a written methodology or work plan that is publicly available for those of us that want to understand a little bit more about how the department and Myers and Stauffer are approaching this work?
Yes, so we have set up a website and we can get you that link later. We're still populating the website. We also put out a listserv not too long ago that describes our stakeholder engagement process in general. Right now, we are working to finalize the specific provider groupings and schedule for the stakeholder engagement. So my hope is that we get that out this week, and that will also be added to the website.
Thank you. I'm going to take a look around and see if any other members of the committee have any questions or thoughts before we move on. I know we're a little bit behind. Senator Sanborn, go ahead.
Yeah, thank you. And thank you, Director. You've given us a ton of information, and it's all been incredibly helpful to try to get my head around it, although I don't have my head around all of this very well yet, but I'll continue to work on that. We've had a fair discussion about rates, and this last part was really helpful to understand where you are in the process with that. Even before we really understood COVID and how hard it was going to hit, we were meeting with providers of services for the IDDD populations and hearing how desperate they were to be able to retain their workforce, who were getting paid less than minimum wage and, have really hard jobs. A lot of the people doing it are people of color, almost exclusively women, a lot of the immigrant community and so on. And, people were just really hurting. The providers were hurting and working incredibly hard to provide the services they need for this vulnerable population. I have a question, and I'm going to actually read a question that was sent to me because I think it presents the issue better than I could sum it up. So if you'll allow me to do that, this is the question. So more than half of the state's adults with intellectual and developmental disabilities are served by Medicaid providers with more than 250 employees who do not qualify for the new grant program. The federal Medicaid Provider Relief Program gave providers just 2% of their annual budget, roughly a 2-week payroll. They are still, with the state Medicaid wage rate, $11.21 or below the minimum wage. Temporary increases ended in May. Rate studies and any potential increases that would be proposed from your department are far off into FY22. We need these frontline essential workers to stay in positions caring for Maine's most vulnerable in high-risk congregate settings. What are your plans to support them financially to stabilize this workforce?
Certainly. So first, I'll just say that nothing that I will say is meant to undermine the fact that we know that these times especially have been very difficult for these providers of critical services for really vulnerable populations. And because of the pandemic, the providers themselves have often been very vulnerable to COVID. So 100% understand and appreciate that and the value of their work. I will say, Ben alluded to this earlier, so under the Appendix K, they call it authority that gives us some flexibility with our home and community-based services. In addition to the temporary rate increases, we were able to provide support that we've heard directly from many providers has been really critical around staffing flexibility. I won't get into numbers, but it's significant flexibility to allow providers to flex with their staff and make sure they can continue services in recognition of these exceptional circumstances. In addition to that, I will say that we are actively engaged in review of our rates for our home and community-based services for individuals with intellectual and developmental disabilities. Those waiver services are up for renewal with CMS, and so the expectation is that we work as we are on our rate methodologies, and so everything comes with a price tag that we are very aware of, but we are also very aware of minimum wage laws, et cetera, and are taking that into account as we look at the assumptions behind these rates and what we may be looking at to support those.
Thank you.
Else to add?
No, I mean, go ahead, I'm sorry.
Oh, no, that's fine. You go ahead.
I was just going to say that there is, I mean, outside of the state provided context for funding, there is $50 billion still remaining in the provider relief funds that need to be allocated and will be allocated at some point. And there's a forthcoming distribution for the Medicaid-based approach, which I would guess would be more targeted to some of these providers than the Medicare-based approach that was done earlier in the year. We are, we're in touch with these providers and continue to evaluate what they're expressing in terms of workforce shortages and other financial needs.
Yes, thank you for that. And I know that you are. I think, they're feeling so desperate that they're reaching out to all of us to try to get those answers. And I'm sure FY22 seems a long, long way away. So whatever you can continue to do to help and to get them answers is much appreciated. Thank you.
Senator Breen?
Thank you. Just a quick question, because, as this committee sits here today, we don't see a special session where we would be doing a supplemental budget. So it could very well be we don't see a supplemental budget until January. And then, of course, we have a biennial coming. So I'm wondering, following up with Senator Sanborn's questions, given that, it seems to me the preliminary report in December is probably something you need to inform the work of the budget preparation, both for the biennial and the supplemental. So I wonder if you anticipate any of these rate changes being reflected in a supplemental budget proposal, or do you think they will be more likely in the biennial? Thank you.
I think, I don't want to get ahead of our budget process. We are still in the middle of it. The governor extended the biennial budget process until October 19th. So I'm not entirely sure if it would be in the supplemental or the biennial budget. It depends on the framing of what's appropriate for the supplemental budget, which has been more emergency type initiatives, as you know. So I guess I don't have a good answer for you right now in terms of the exact vehicle that we would be going forward with that.
Okay, thank you.
So before we move on again, I just want to say I very much appreciate all the information and the way it was delivered today. I certainly think it exceeded my expectations, which I mean that as a compliment. It was really comprehensive, and I certainly appreciate the information that lays out what the department has done to support providers through the pandemic, which is really important. And I think when you see it laid out the way that you guys have put it to us, you can see that there has been a lot. But I do want to sort of add to or complement the comments and questions that Senator Sanborn made. We do hear frequently from the same folks that I'm sure you do. And there are providers, not just people who serve folks with developmental disabilities, but people who serve the elderly, people who try to deliver behavioral health services in the community. And I can see here that you've done things for those providers that are really important. But again, as I sort of look at the broad view, We have achieved a lot of savings in our main care program over the last 6 months, primarily because of the FMAP. And as someone who spends a lot of time worrying about the state budget situation, I think it's important to see, the executive branch utilizing that money to balance the budget. But I also, again, don't want to forget about people who need help now. And I hope the department will continue to evaluate what resources it has to help those folks, the things it can do quickly. We still have $29 million in a main care stabilization fund, again, which we might need next year. But I and others, including I'm sure people around this horseshoe, continue to be incredibly worried about how services are delivered to some vulnerable populations in our communities. And want to make sure that is still being looked at and addressed very carefully by the department. So that wasn't a question. It was just the chair's prerogative to sort of get the last word in, unless I see somebody else waving their hand around. Okay. Well, thank you very much to the folks from DHHS for joining us today and giving us all this information. I'm certainly going to make sure that other folks see it, including our colleagues on the Health and Human Services Committee. And now I am going to move to the next part of the agenda, which I believe is Michael Allen to talk to us about the latest revenue report. Dr. Allen.
Good afternoon.
Good afternoon.
Okay, I believe you have the commissioner's report on August revenues and the controller's report that goes with it. And so that's what I'll be speaking to. August revenues were over budget by 34.9 million. That was a variance of 11.7%. And for the fiscal year, general fund revenues are over budget by 22.3 million, which is a variance of 3.9%.
May I interrupt?
Yeah.
I think what you have is the wrong revenue report. I'm very, very sorry. I think it's the August report. So I will quickly, while Dr. Allen speaks a little more detail, try to get you the correct one.
Okay.
All right. So just focusing on the year-to-date general fund variance of 22.3 million, it's actually a little better than that because the unorganized territory property tax that is paid in October was budgeted in July by mistake. And so there's about 12 million. When you get the controller's report, you'll see that year-to-date other taxes and fees is under budget by $15 million. And so it's really not that bad. It's just a timing issue. And so if we adjust for that roughly $12 million, then the general fund is about $34 million over budget through August, which is a positive variance of, 6.1%. The Exhibit 2 of the controller's report looks at monthly and year-to-date revenues compared to a year ago. And compared to the first 2 months of fiscal year 20, revenues are down 43.1 million, which is about 6.8% below where they were a year ago. If we adjust for the increase in revenue sharing from 3% of the income and sales tax lines to 3.75% for this fiscal year, then we're down 6.1%. And even there, it's not as bad as it looks because remember, both the individual and corporate income tax final and estimated payments that were due in April and June of last fiscal year were deferred until July. And the accrual that was made in fiscal year 20 was reversed in the month of July. And final payments, particularly for individual, final payments and estimated payments came in less than we had expected. So the individual income tax line is about $32 million less than it was at this time a year ago. And the bulk of that is just because of that reversal of the accrual and the timing of when those revenues came in. So we're actually, I would say maybe flat for the first 2 months of the year once you adjust that out. So not great, but certainly given the economics conditions and the pandemic and all that we've been through, revenues are holding up pretty well. Just looking at some of the detail on the sales and use and service provider taxes, combined, they were over budget in August by 9.8 million. That's a 6.4% variance. We had assumed that those two lines combined would be down 7.7% compared to last August. And they actually ended up being down by 1.4%. So again, down compared to last August, but not nearly as much as we had anticipated. Most of the main reason, or one reason why August revenues performed better than expected, was from the lodging taxes. We had assumed, so this is August revenue that reflects July activity. We had assumed July lodging sales would be down 57% compared to a year ago. And they only ended up being down 40%. So again, 40% is a lot, but not as bad as we had anticipated in the August 1st revenue forecast. So that contributed about $4 million to the $10 million surplus on the sales and use tax line. Auto sales contributed another $3 million to the monthly surplus. With just focusing on auto sales by dealerships here in the state, we had assumed that they would be down double digits compared to a year ago. They were only down 4.4%. So again, performing better than we had expected. Restaurant sales were down 30% in July, which is exactly what we had forecast. And just another thing I would point out is that if you kind of remove from the taxable sales report that accompanies the commissioner's revenue report, if you remove restaurants and lodging from the comparison of taxable sales, year-over-year comparison, the rest of the categories were up 9.4%. So at this stage, it really is those meals and lodging, the tourism-related sales that are obviously heavily impacted by the pandemic that have brought us down to a reduction in revenues, but again, not nearly as bad as we had anticipated. Other states are seeing similar results on the sales tax lines, either very small declines year over year. Some states are actually seeing small increases. So I think we're all pleasantly surprised at how well the summer season has gone across the country. I think the explanation that most people are pointing to, again, is the CARES Act stimulus, the $1,200 checks that went out to people, $2,400 in the case of joint filers, the additional unemployment benefits of $600 a week. All of that was providing stimulus to the economy, PPP in addition, that was putting money in people's pockets. And whilst a lot of it was being saved, a lot of it was also being spent as well, and that's helped keep sales up. Concerns going forward on the sales tax is that that a lot of that CARES Act stimulus has begun to phase down or is phased out altogether. There's the presidential executive order that did extend an additional $300 a week that I believe Maine opted into, but that's obviously a decline from $600, and I believe that's about to expire soon as well. And without another stimulus package on the horizon at the moment, I think there is some concern as we head into the fall and particularly into the holiday shopping season that a lot of that stimulus that was helping particularly lower income and lower middle income households is about to disappear. On the individual income tax, it was over budget by 17.2 million in the month of August. Most of that was from withholding. That was $14 million over budget. Final payments were over budget by $6 million, and estimated payments were over by $2.1 million. Focusing in on withholding for a minute, for the first 2 months of the fiscal year, withholding is up 9% over the same 2-month period a year ago. If you remove the withholding from unemployment insurance benefits, withholding is up 3.2%. So again, those enhanced unemployment benefits have been helping with our withholding, keeping that line up and keeping it up much better than we had anticipated. But again, even when you remove the impact of the unemployment insurance benefits, still up 3.2% with a pretty high unemployment rate. And again, talking to colleagues across the country, all kind of scratching their heads, seeing similar results. Geez, when you look at the unemployment rate in the state, you would just imagine that we wouldn't be seeing any growth in withholding, and yet we all seem to be in these lower single-digit growth rates that we're seeing. So a little head scratching on exactly how this is all playing out over the summer. The surpluses on the final and estimated payments, I think, is probably, again, overhang from the fact that those April and June final and estimated payments were pushed to July. And it's not unusual for some of that revenue to come in, particularly for final payments, a month or two after the due date. Sometimes taxpayers don't have the cash to pay on the due date, or they can't pay the full amount, and they enter into agreements with Maine Revenue Services to pay over a month or two or three. And I think that's what we're seeing for that. On corporate income tax, that was over budget for the month by $6 million. That was kind of spread out across the three sources of net corporate income tax. Final payments were over by $1.9 million, estimated payments by $1.7 million, and refunds were under budget by $2.4 million. And again, I would attribute that to the delay in payments, filing of tax returns from April into the month of July. And again, just like individual filers, there may have been some people that entered into payment plans with Maine Revenue Services and were now getting that revenue. Just looking at where we are so far in September, we have 6 processing days left to go in the month. Sales tax is currently over budget by $3.8 million. We had assumed that September sales tax revenues would be down 9.4% compared to a year ago. I'm just guessing at this point that it's probably going to be closer to 2 to 4% down. So again, not nearly as bad as we had anticipated. I would assume, again, based on what happened in July and what we're hearing about August tourism activity, that lodging sales probably performed better than we had anticipated. The assumption in the revenue forecast was that August lodging would be down 52%. So I assume we did much better than that on that. The monthly sample that we look at looks similar to what we've seen in other months. Building supply stores continue to do extremely well. Automobile sales, while down, not nearly as much as we had anticipated. Those types of areas continue to do very well. Remote sales, sales taxes continue to be extremely strong as well. And just a reminder too, that at this time last year, we weren't receiving revenue from marketplace facilitator sales. We are now, and those continue to come in, maybe a little bit better than we had anticipated. Withholding looks like it will be over budget again. Not sure by how much at this point. And I suspect some of that is probably because of the extended unemployment benefits of now $300, but that's going to be winding up I think at the end of the month, DOL told me, but we're still getting really historic levels of withholding from unemployment benefits. Certainly much more than we were getting in January and February when the economy was still operating at a solid rate. This is a key month for individual and corporate estimated payments. The third estimated payment of the calendar year was due September 15th. We will be under budget on both of those, not by much, but we will be under. Again, not sure with 6 days left to go, but I don't see us receiving enough over the next 6 days to get us to budget. The last thing I'll talk about quickly is just the highway fund. Motor fuel excise taxes were over budget by $1 million in August. And for the fiscal year, they're over budget by 1.3 million. As a whole, the highway fund was over budget by 2.1 million in August, and year to date is over budget by $3 million. So again, similar to the general fund, it's performing better than expected. Compared to last August, motor fuel excise taxes were down 11%. And for the first 2 months of the fiscal year, they're down 13%. So we were looking for something more like 15 to 16% down. And they seem to be, again, performing a little bit better than we had anticipated, only down by about 10 or 11%, but still down quite a bit because of people's driving, and I assume some decline in tourism activity during the month as well. So, happy to answer any questions you have.
Thank you, Dr. Allen. Senator Breen has a question.
Thank you, Dr. Allen. I just want to go back to the August CEFC and the revenue report. If I recall correctly, baked into that work was an assumption that there would be an additional $1 trillion in federal assistance coming to Maine. Coming to the country, and some portion of that I think would come to Maine. That hasn't happened thus far. So I'm curious to see what impact that's having. Did you account for that when you were budgeting and comparing to budget? Or is that assumption still baked into your budget, your budgeted numbers, and how are you handling that?
So you're right, you're correct. The CEFC had assumed that there would be another stimulus package passed by Congress, roughly $1 trillion. Some of that would come through in the form of extended unemployment benefits. They didn't say, they thought it was going to be another $600, but it would be some additional benefit, and that there would be some help to states and local governments in that package as well. That was built into their economic forecast that we use to develop the revenue forecast. It's still early in the fiscal year, in a sense, even though that stimulus hasn't been acted on by Congress. The CARES Act stimulus is still having its impact in the first couple of months of the fiscal year, but certainly as we go on into the fiscal year, the lack of an additional federal stimulus package may start to have some impact on the economy and therefore on revenues. Just a note that both the CEFC and the RFC are having our annual retreat. We're all retreating to our basements or bedrooms or wherever we're retreating to these days, and having a remote retreat tomorrow. And so I'm sure that's going to be a topic of discussion.
I don't remember seeing the invite to that. Did you, Senator, Representative Millet?
It's in your basement.
No? Okay, thank you.
I think I would add, if it's okay to add, that the thought of federal stimulus as CEFC was considering its forecast is one of many assumptions that we have to make during this time. But as we say over and over, some of the assumptions that we make then get replaced with some of the actual information that we have. So although the federal stimulus may not come at the timing that was assumed as part of that forecast foundation, Since then, we've also learned that some of the assumptions that we have around lodging or sales have been different. And so the down of the one might be offset by the up of another. But I think it's really important to reiterate what Dr. Allen said, in that there are so many considerations happening right now. And as of at least during their latest, both IHS and Moody's are still anticipating some version of something from the federal government, as I think the federal government is indicating in different words than they might have been doing in June, but still definitely topic of conversation. So.
Thank you. Any other questions for Dr. Allen? Representative Millett.
Thank you, Mr. Chair. Dr. Allen, you kind of gave us some anecdotal information of September with 6 days to go, and I didn't capture all of it, but based on what you know, Mike, through today or yesterday, do you see a trend for the first quarter, reflecting again on what the Senate Chair referenced in terms of the assumed stimulus money that might be forthcoming? Would we still, in your opinion, be in the black compared to the August 1 forecast at the end of this next week, in your judgment? And is there any assumption or conclusion you can draw from what you know of the first 3 months of actuals, how that would play out over the balance of fiscal 21?
Yeah. Speaking just for the tax lines that Maine Revenue Services administers, yes, I think we will be at the end of the first quarter of the fiscal year, we will be in the black on the tax lines. There's no doubt about that. We're already over. I'm looking at 3.1 million as of today on the tax lines. We are over budget year to date. So, and we've got 6 more days to go. So that's going to continue to rise. I think the first quarter of the fiscal year has gone better than we had anticipated. When we met at the end of July, there was, the data we had was through June. And for instance, lodging in June was down around 60%. And we assumed that lodging sales would improve, but they would obviously still be down closer to somewhere between 50 to 60% in July and August. That it's clear now that they did better than we had anticipated. People are continuing to buy automobiles at a better pace than we had anticipated. Overall spending has continued to be much stronger. Maybe looking back now, maybe that shouldn't be as surprising, again, given all the stimulus that had come in to households in April and May, and knowing that a lot of it had been saved and has been utilized in July and August and now into September. But I do have concerns as we head into the fall and head into the holiday shopping season. Those are some big months coming up. Meals and lodging start to become a smaller portion of our base, particularly lodging. So, and things like automobile sales and general merchandise sales and those type of things start to become more important, particularly as we go into November, December period around the holidays. So, so far so good, but we're just going to have to watch what happens over the next quarter, certainly.
Thank you.
Any other questions for Dr. Allen? Thank you. And again, we'll continue to monitor this month by month, and in a couple months, we'll have a new economic forecast and a new revenue forecast. So thank you very much, Dr. Allen, for the update.
Thank you.
Just want to say that I have gotten a couple messages that folks listening to this meeting through the legislative website are not getting great sound quality. And some of those same people have now told me that when they go to the YouTube feed that the sound quality is actually pretty good. So if you're trying to track us on the legislative side and you're not hearing very well, if you have the option, you might want to move over to the YouTube feed. Thank you. Next on the agenda, Commissioner Figueroa. Good afternoon, Commissioner.
Good afternoon. It's nice to see you all.
Nice to see you.
My agenda items are many, but I feel more like it was set up as a Q&A. I'm going to do a quick update of our CRF funding, and then really open it up, I think, to questions. So the first update that I have is on the 1.25 billion CRF funding. The document that is posted on the Bureau of Budget website is as of September 16th. And I think that you all have a copy of that and that it's been posted. And that would show that to date, we have committed nearly 944 million of that 1.25 billion. And there is a remaining balance of $306.3 million. I would update that today with a couple of items from that have happened. One was the announcement last week that the governor added $10 million to the rental assistance program at Maine Housing. That program had previously received $5 million and from CRF, and so that brings the total up to 15 million. Also,
I actually had not seen that. Was there a press release or any public notification of that, or did I just miss it?
I think there was a press release. I can do a little background on that and make sure that you all get.
I just hadn't heard that, and I'm happy to hear it. So thank you.
Yep. And then I believe that it has been, we have talked about education funding as a phase 1 and phase 2 for a total of approximately 325 million, I think. And we are officially announcing phase 2 today. That's you'll remember when Commissioner Macon met with you and outlined some of the pre-work that the schools needed to do. And then once the schools were open and had the staffing, some staffing changes or additions really to ensure that the classrooms were staffed and the extra people needed. I'm not speaking very clearly right now, but I will in a minute. The extra people that were going to be needed and the extra work that was actually going to be needed once schools opened would be phase 2. And so we're announcing phase 2, and that work is ongoing with the department. So that would leave a balance not committed of approximately $130 million. The Bureau of Budget website page shows the amounts that have been expended to those commitments, which is roughly 500 million out of the 943, and now closer to 1 billion that I just spoke about. And we try to update that weekly. I think the other items on my list are the FY21 budget gap proposal that we had submitted to the governor, and that the governor has since approved, resulted in the curtailment order that you've heard about today and through the press release, as well as some unencumbered balances that are available, as well as some of the funds that are at the Maine Municipal Bond Bank, the result of alcoholic beverages sales. And I think those, I'm happy to take questions. I think those were my two updates.
I see a question from Representative Peirce.
Thank you so much. Great to see you, and thank you for the information. I am curious a little bit about the funds that we received early on with CARES around the elections and being able to help municipalities deal with that. I think it was 3.2 million. We don't necessarily always get an update from you around that, correct? And I'm wondering, is that just solely squarely in the Secretary of State's office where I should ask those questions, or do you have some assessment of that? I know that we're incurring a lot of costs at the municipal level trying to run these elections, and I want to make sure that we're reimbursing municipalities around those things. And so I apologize for maybe not requesting that to be on the agenda at some point. And you can certainly direct me in another direction, but I thought I'd bring it up.
Yes, thank you. So as we've distinguished, there's like nearly, I think the number at this point is nearly $7 billion that's come into the state from CARES and other federal efforts. The 1.25 being a component of that. The monies that you're speaking of were a separate CARES Act grant or award. And I'm sorry, I do know some things about what's happening because, right, our procurement division is involved with helping with some of the ballot box, drop box initiative, but I don't have the specifics on where the grant is as far as the 3.2. Absolutely willing and will follow up with the Secretary of State, and I'm sure that he would easily be able to give an update that we can send around to you.
Thank you.
Any other questions by members of the committee for the commissioner? Commissioner, oh, go ahead, Representative Arata.
Okay, sorry about that. My question is about the hiring freeze. From what I understood, there was a hiring freeze early on in the pandemic. So is there currently a complete hiring freeze, or are you still hiring in certain departments? And was that the intention all along, to keep hiring? I guess I just want some clarification. Thank you.
Yes, thank you for the question. What we are doing is hiring with an emergency basis scrutiny. There are a number of efforts that happen in state government that we just can't not fill those positions, specifically thinking about some of our public safety, public health, even in DAFs, for instance, we're starting an incredibly large project around replacing, as you know, the main revenue services tax system. And one of the assumptions there is that we will not hire additional staff to help with that project, but need to have the positions that we have filled to help with that project. But we are, every hiring that we do is meant to come to the commissioner level and ensure that it's of an emergency or absolute need nature. So that has been and will continue to be the process.
Can I just add a little more detail around that, Commissioner? I appreciate the question from Representative Arata. So for example, over the last couple of years, we have made, in response to things that were happening in the community, we have made investments in child protective workers and public health nurses. I mean, has the pandemic had a negative impact in the state's ability to fill those positions? Again, I think a lot of people are concerned about the well-being of children out in the community, especially during the pandemic.
I think that the state as an employer is struggling in the same way that we're hearing from all employers. I mean, that it's an interesting thing that we're getting back to a place of not having enough people for the positions. And in particular, there are some that are harder to find than others. I I would talk specifically about our accountants, for instance, or technology people. Technology right now is all the rage. And so we hire someone, then they're almost immediately pulled away from, I'm just putting it out there, the state paid position to a much differently paid position in a private firm. So, and I know that that is the case for healthcare workers. I believe that Commissioner Lambrou just mentioned that our healthcare provider community is struggling to find, and that's the same for our public health positions. That was kind of an issue before. Now, some of the changes that are happening as a result of the pandemic is that a rural state that has lots of room to spread out is seeing some transition. And I think Commissioner Johnson can speak to, you know, some of the worker transition that we're seeing. But some of those workers come with their job, right? They're moving here and still teleworking to their old position. But I think it might be a little bit too soon to talk about whether that trend is going to help us actually fill some of those positions, but we still have a healthy vacancy rate in Maine state government as a result of ongoing hiring issues.
Thank you. Probably not too surprising. Any other questions for the commissioner? Representative Jorgensen. Eric, go ahead.
Thank you very much. I just wanted to say, Commissioner, I enjoyed the Digital Government Summit last week, and I appreciate that you invited us to it, and it was good. So thank you.
Yeah, thank you. Did you like the kickoff?
I was going to say something about it, but then I opted not to. I thought maybe you should have brought your slides or your cards with us to the to this meeting, but it was fun. Good.
Thank you. Trying to find ways to laugh.
So, Commissioner, based on the information you just gave us, you know, this spreadsheet has now been updated or will be updated, and I think you said we now have approximately $130 million of the CRF funds on account, you know, where the governor hasn't announced yet how she intends to use that.
Mm-hmm.
You know, some of us on this committee, myself included, again, continue to look at the report from the Economic Recovery Committee as a good roadmap of how that money should be allocated. And you know, I think if you look through this document, you see areas that were part of the ERC recommendations that have been addressed, but I still think that there are some areas recommended by the ERC that haven't really been addressed yet by the administration. Some support for higher ed, some support for new Mainers, you know, immediately come to mind. There's probably some others. I'm not cross-referencing the report right now. You know, what if anything can you tell us about what the administration's plans are for the use of the balance of the CRF funds? I mean, what is on the horizon, you know, that you guys are thinking of in terms of being a possible important use of that money?
Well, I think that the way that I would answer that is to say that I think that the Governor Mills and the decisions that, you know, that ERC and appropriations have been helping or have been communicating with about we haven't met any one need in full and have been doing a thoughtful process at each step about what is, for instance, in the beginning, it was education, and then we did the business grants, and what is the timing and what is the need and what is the next thing? The rental assistance being one of the ones that's kind of popped up a couple of times. But as we say that, we've also been very clear to say there's not enough money for all of the need. And so at this point, I don't believe that we have any specific, that I could give you a clue about what's next. However, we know we need to make probably some decisions about testing. There was a grant to, you know, one of the CARES Act awards to DHHS was testing. And those monies, to my understanding, are all but accounted for. And I think that testing in the higher ed environment, as well as pre-K through 12 and, ongoing ensuring that ability for us to test Mainers in whatever environment that they're in is a priority. And then we are watching the business grant, which I know Commissioner Johnson will be coming on in a few minutes to talk about. We're watching the activity that happened there, and you'll get an update on that. And that round 2 will be going out. And then what pockets possibly were, for instance, she'll talk about, a new business. She'll talk about new businesses, but what other pockets may have been missed there. So there's some thought about making sure that we have a little bit of funding there. Still maybe holding out a little bit of hope that the federal government will give some thought to revenue backfill, which would be a way for us to support municipalities in a different way than we've been able to. If we were able to, do a, this is what you would have gotten kind of payment if our revenues hadn't dropped. Although I will say that the increase from 3.5 to 3.75 on revenue sharing has all but evened out the amount of money that they're getting. I think that, I hate doing this and I do it every time, but maybe we're 7 million less than we were last year, which I think people might have thought that would be a bigger number. I just did it and I can see Jenny going, don't say that word. So I will get you the actual number, but it wasn't as far off as you might have thought, considering, talking about a reduction in revenues of $500 million over the fiscal year. So I think those are some of the things we definitely are hearing. The conversations of your healthcare provider outreach, and have been working with DHHS on that. And of course, there's been different funding sources from CARES and federal resources, and from, DHHS rates that have helped with that. So all of those things are still in consideration, and all of those things have a much bigger price tag than the remaining 130 million.
And again, I just want to say again, reiterate, probably beating a dead horse here. I still hope that the administration puts that plan that the ERC put together to good use, and there are some things in there that are currently unaddressed, and I hope those will continue to get consideration along with all the other, really important things that you just mentioned, Commissioner. So thank you. I think Representative Hubble has a question. Go ahead, Brian.
I can't hear Representative Hubble. Oh, okay, I'm not the only one.
Brian, are you there?
Hello? Got me?
Yep, we can hear you.
Sorry about that. I just want to say I share the chair's interest in the ERC recommendations, of course, and Commissioner, also, as you know, I've had a longer interest in the allocation of that funding for testing, which was outside the CRF. So if we're reaching a point where that $53 million for testing has been expended, at some point I would be interested offline in just seeing a breakdown of that, and also perhaps a context of how much of that is being used at the state lab, and what just sort of the overall testing expenses the state are. And I happy to take that way offline.
Okay, I will put that on the list.
Thank you. Commissioner, I don't want to just sort of like brush aside the curtailment order, which obviously is incredibly important and certainly going to be a focus of this committee going forward as we move into the next session and deal with the supplemental and the next budget. Could you just take a few minutes and walk us through sort of the high level, the strategy behind the curtailment order and how it broke down. I know a number of us have probably understand this, but for people listening and watching, I just think it's important.
Thank you. So when the Revenue Forecast Committee met, CEFC and Revenue Forecasting Committee met off cycle, and the RFC did a new forecast in August. They had projected, as a result of the pandemic, an impact to our revenues, approximately $528 million in FY21 and another $850 million in the biennium, the 22-23 biennium. As a result of that, it puts our FY21 budget that we had enacted right before you all left, that we had done a supplemental. It puts our FY21 budget out of balance, which requires some action from the DAF's commissioner and the governor. DAF's commissioner, that's me, sent a letter to the governor indicating that our budget was out of balance, and then asked agencies to, the governor asked agencies to look through their FY21 expenditure plans and asked staffs to look at other options to fill the $528 million gap. In early September, we sent a letter to the governor proposing how to fill that gap. And we had 4 components. One was because the legislature left some funds on the table when it adjourned in March. We were able to lower the 528 by 106 to then have our gap be for the biennial, the 2021 biennium, to be 422. To fill the 422, we proposed to use approximately $107 million of the CRF funds towards eligible payroll expenses of our public health and public safety employees. That will be a part of the curtailment. In that, we will curtail that $107 million. That's a combination, by the way, of general fund and highway fund from those departments. And instead of using those general funds and highway funds, they will use CRF funds to pay those expenses. Another component was using unencumbered balance forward from FY20 of approximately $130 million. Another proposal was to use some of the revenues generated from alcoholic beverages sales in the state that have been at Maine Municipal Bond Bank to the tune of $70 million. And then the remaining amount is a result of agencies going through their FY21 expenditures and making reductions through either freezing vacant positions, not doing some efforts that we had planned, like not moving forward maybe with a contract that we had planned, or reducing the scope of a contract. Some contracts weren't being done because they were a priority for us back when we were talking about this in the 2021 biennial budget creation. But when the pandemic came, that can no longer be a focus. Obviously, we've had conferences or travel that we haven't been able to do. So we all looked in the spirit of the fact that the reductions are approximately 10% in each year of the revenues. Projections are 10% in each year. We asked agencies to try to come up with a 10% reduction. None of the agencies were able to do that without impacting some of the governor's priorities, which at this point were not laying off state employees, continuing to ensure that we were able to continue to offer and provide the services that Maine citizens expect from us, especially as those services have been more utilized than ever during this pandemic. GPA was not a component of the curtailment, and then ensuring our health and safety network in the state. And as a result, agencies were able to come up with approximately 3% of reductions to our current appropriations of $125 million. So if my math, that's 125 and the 107 of CRF, that's the total of the curtailments. And then the unencumbered balance and the municipal bond bank transfer are funds that are sitting aside, and all of that will be part of the supplemental budget that we put forward next year when the legislature convenes, adjusting for whatever changes may be happening. So that was our plan, knowing what we knew on the day that we made the plan. As you know, we just heard that revenues are higher than anticipated. If nothing else changed about our budget and our revenues, as of the end of August, we would have additional 22 million, I think was the number that we are year to date. So that would change our $422 million hole to 400 million. And therefore we would be able to adjust one of those components. That's something, as we've stated, as we've stated really from the moment that we do this revenue projection and then expenditures to projected revenues, every single month will make a difference, and we'll adjust that plan as we finalize the supplemental. But those are the components. Basically, I'd like to just take another opportunity to say that a curtailment means that we're setting the funds that you appropriated aside to prepare for the anticipated hole. It doesn't cut that appropriation, it just sets aside, and it's adjustable. So what we've decided now and what can be seen in the specifics of our curtailment on the spreadsheet may change by the time we get to proposing the supplemental budget based on something that we know then that we don't know now, and we might swap one item out for another. I actually have a couple of those in the curtailment that I'm hoping will happen for my department. But we will make those adjustments after we see more what happens with revenues and after the CEFC and revenue forecasting of December 1st. Does that help? Yeah.
Yeah, thank you very much for that overview. Senator Breen, do you have a question?
I do, and I just want to, well, I have something I want to underline. Typically, curtailments are applied across the board to state government, and we obviously have a big exemption right now with general purpose aid to education. And I just want to explain to those listening why that is. And I think it bears underlining. So I want to underline it, which is that when the pandemic hit, in the time of year, the forms that go out to school districts that tell them how much money they're going to get for the coming school year had already gone out. Those are called the 279 forms. And school districts all over the state were in the process of working on their budgets, finalizing their budgets with those 279 numbers in hand. And so when we had the supplemental budget, we had an emergency situation. I think the administration, the legislature felt very strongly that we needed to vote that those numbers in so that we were not leaving school districts all over the state and therefore property taxpayers in limbo. So the fact that we took that vote right before we adjourned in the supplemental budget meant that it was a very clear statement from the legislature about our intentions around that funding. And the way the curtailment language is that the curtailment has to be done consistent with legislative intent. So the fact that we had just very deliberately passed that education funding gave an indication to the administration that, that was important and that was our intent. And so because of the other ways that the administration used reserve funds and various other things, we have been able to keep general purpose aid to education consistent with what we budgeted back in January. So I'm happy that we were able to do that. But I just want to be clear that going forward, there's nothing other than that vote we took that exempts general purpose aid to education. So when we have a biennial budget and all that stuff going forward, those investments will be consistent with all the other investments in the budget as we look forward at revenues and that sort of thing. So I just wanted to clarify that for folks, that it was a lucky and somewhat lucky, but also somewhat deliberate happenstance about when the pandemic arrived in our process. So I'll leave it there. Thank you.
Thank you, Senator. Any other questions or comments for Commissioner Figueroa? And Commissioner, again, I think you touched on this. So, if you look at the structure of the strategy for bringing 2021 back into balance, there's really kind of like 4 or 5 big pieces of it. And most of these items that you outlined, especially to the extent that they involve utilizing things like the Babylon money and other things, that will have to be ratified or deliberated on by the legislature when there's a supplemental. Is that correct?
That is correct.
And again, at this point, it sounds like, again, I'm hearing pretty clearly that the administration's intent is that supplemental is going to be brought forward in the early days of the 130th, not in the latter days of the 129th. Is that right?
Well, so what I would say is we're definitely going to wait until after we have December revenue forecast.
Okay.
I mean, yeah. I mean,
okay.
Yes, next year when the legislature comes in.
And there's nothing that jumps out at you in terms of the state's current financial situation that you think merits doing a supplemental now as opposed to waiting until that point.
No.
Okay.
No.
Very good. Any other questions or comments? Commissioner, thank you very much for joining us today and waiting patiently. And now I'm going to turn it over to, I see Commissioner Johnson is here. Again, Commissioner, I appreciate the fact that you've been, we're about 35 minutes behind schedule. So thank you for joining us. And I think what we want to talk about. So I'm going to turn it over to you in case you want to introduce the topic and tell us what's going on with this program that I hear so much about.
Great, thank you. Thank you for making time today to talk through the program. Certainly very interested in your feedback. So 200 million of the CARES Act funding was allocated to support businesses and nonprofits. The Governor's Economic Recovery Committee had established some framework as it related to supporting what they refer to as employers. We actually changed that language a tiny bit because we thought it was really important to make sure that we captured sole proprietors as part of this program. And the chairs of the ERC agreed with that as well. So the Maine Economic Recovery Grant Committee grant program will support businesses and nonprofits. In phase 1, we supported businesses under 50 and not businesses and nonprofits under 50 employees. We'll talk a little bit about that. Try to take the ERC work. We looked at a lot of best practices and learnings from other states. A number of states had gone before us. And so there were some learnings out there of things that worked well, things to avoid. And we obviously had to combine that into the rules that, as we knew them at the time, of the CRF use and reporting requirements. So we looked at who to partner with, right? Because this is a statewide challenge. We wanted to make sure that we were talking to businesses and nonprofits all across the state. So we partnered with the 7 economic development districts. They really determine eligibility. They do a lot of the follow-up. They also did a lot of the support of the application submissions. And then they have the resources and will do the disbursements as well. So phase 1 of that program closed on September 9th. Phase 2 actually opens today. The portal just went live about 30 minutes ago. And we can talk a little bit about the 2 phases. I thought we'd do a little bit of high level of the how do we do this, and then go into phase 1 and a recap of what we know today, and then talk a little bit about phase 2. So, and I think you all have some slides that we, excuse me, some slides that we sent in. If you look at the 3rd slide, it looks at this process flow. And I think the process flow, I won't spend a lot of time on it, but the reason that this is important is there were a number of groups involved in kind of the execution of this program. So we have a centralized application portal that we created in order to have consistency. Then the local economic development district takes those applications and they review them for eligibility. There are a number of eligibility factors, and we can talk about those if you're interested in that. And they determine who's eligible based on the criteria. Then those come back in to a centralized grouping, and then Maine Revenue Service takes those and looks at checks, are they in good standing? Do their federal taxpayer numbers line up to the information we have? All of those types of things. Excuse me, if all of that's in alignment, then they go back they go back to the EDD for final review, but then they'll go into the disbursement calculator. At that point, the EDD will get a list of the disbursement value, and then they will issue out the checks. Obviously, there are a couple of points there that businesses and nonprofits may not be eligible. And if that's the case, they drop into an ineligible bucket for a variety of reasons. So that just gives you a sense of the flow. The reason this is important, there are a couple of reasons that this is important. We feel very strongly that businesses across the state and nonprofits across the state need real support as they evaluate these programs. So the 7 EDDs are one way to do that. We also have a variety of other economic development type groups that are helping businesses and nonprofits through this process. The process isn't incredibly complicated, but for this morning we were on a webinar that we hosted, and there's a childcare facility on there, and the owner said, "Look, I've never applied for anything before. I don't know how to do this." And so, that was a great example of, even if the process isn't super complicated, for people who have never had to approach this type of activity, it's daunting. And so we want to make sure that they have a lot of places to go to get help and support. So if you go to slide 4, I say early estimates of phase 1. The reason I say that is the evaluation process is still underway. So the economic development districts still have time to review additional information. Maine Revenue Service is still reviewing information. So I tried to grab just some preliminary rough numbers to give you a sense for where we are. So in the first phase, we think there'll be about 2,750 eligible grants. That's not how many applications we got. We received something just under 4,000 applications. A variety of them weren't eligible for a variety of reasons. We think about 2,750 will be eligible. If you look at the average grant size, it'll be about $45,000. There's a lot of discussion of, is this going to be worth my time or not? And so we're trying to give people a sample set of, here's what phase 1 looked like. That is worth it, I think, to most businesses. As we talked to businesses, it took them somewhere between 30 minutes and an hour and a half to fill out the application. And so, I think most people would say that that was invested time well invested. The total qualified loss ballpark is about $220 million. that we're seeing right now. Again, still more work to do there, so I want to be careful, but I knew that you would want some scope of where we currently are. And then the grants each had a $100,000 cap. So for any business or nonprofit that had more than $100,000 loss, we capped them at $100,000 in order to, again, this program is really all about business viability. It's not about replacing profits. It's not about replacing revenue. It's not even about expansion or some of the things that that are normally in my wheelhouse to talk about. This is just about trying to keep infrastructure viable as we move through this pandemic until they can build their own capacity back. So as you add in the $100,000 cap per application, you end up with a total loss of about $100 million. One other thing that we were tracking is how many of these businesses got PPP awards. So how many got kind of forgivable idle loans as well and are still struggling, right? They were eligible. We recognize that for most businesses, it will take more than one program to help them through this pandemic. So PPP didn't lock you out, but it did say that forgivable amount needs to be captured as a reduction in expenses, so that you would be less eligible with lower qualified loss. But certainly a lot of businesses and nonprofits still had qualified loss after PPP was acknowledged. So that's just something to keep in mind as we continue forward, is this need to have layered options for businesses and nonprofits to try to keep that infrastructure viable. So if you go to slide 5, this again, I tried to be really clear that this is preliminary, but we took what we believe at least kind of currently to be some the eligible application base and mapped it against their industry sector that they identified. And so I think it correlates really well to what Dr. Allen was talking about earlier, right? Accommodation and food services was the largest group, which makes perfect sense. And then as you work down agriculture, arts and entertainment, probably what you would expect as you look at the actual economic results, right? Durable goods are actually holding pretty solid right now. It's the service industries that are seeing the significant fall off. So this just gives you a sense. Obviously, this isn't the complete list. I tried to take the top few as a percentage so that you had a sense for where that looked at. The nonprofits that you see here at 10%, some of the nonprofits identified as a business sector separately from nonprofits. So that number's a little bit higher than that. It was how they put their applications in. The Economic Recovery Committee, I think, had it closer to 15%, approximately 15% would go to nonprofits and 85% would go to 4 businesses. 1 in 6 Maine workers works at a nonprofit organization. That includes hospitals. Hospitals weren't eligible for this program. So you can see there are some, a few disconnects there. In the first round of applications, we saw, I think, what you would expect to see in the first round. If you go back to the PPP first round as well, just because that is similar in its kind of intent to support, the number of businesses percentage-wise is a lot smaller than in their second phase. So as we look to move forward in a second phase, we tried to think about who else needs to be eligible, right? Governor really wanted to focus in on small businesses and make sure that they were covered and captured, and small nonprofits were covered and captured in this first phase, recognizing that the other programs that had existed were maybe more difficult for them to utilize. So we did that in phase 1. We kept the eligibility fairly narrow to intentionally get to the smallest of businesses and nonprofits first. So if you go to slide 6, you can look at what is now phase 2. So phase 2 will take the remaining 95 million from the original 200 million. Obviously, you can see if you're doing the math, 200 million minus what we are anticipating is 100 million. There's still 5 million there. That would be great. If that 5 million plays out, we will certainly put it into phase 2. We're trying to, right, as we are still validating some of these applications, we needed to be careful not to oversell phase 2 until we had phase 1 closed out. So That's that. We have increased the employee cap from 50 full-time equivalents to 250 full-time equivalents. That'll add in about 1,486 businesses. That does not include the increase in nonprofits, partly because of how nonprofits report. That's a hard number to come by. So that's one of the differences is businesses and nonprofits don't have to have just 50. And we heard that a lot from nonprofits, in part because of the way they fund contractors, and contractors are the equivalents of nonprofits in this sector. The other thing we heard from a lot of businesses that you would expect to be under the 50 were they had affiliated businesses in a way that put them over that cap. So we think 250 will help a lot of those affiliated businesses and smaller nonprofits that use a lot of contractors as well. So we've increased the employee cap. We have added in childcare facilities. We heard from a lot of childcare facilities. There are 1,684 licensed childcare facilities in the state. And while there are some small programs coming out of HHS to support them, the need is still fairly large. And so we've added childcare facilities in there as well. Behavioral health services were available in the first round, but most of them had more than 50 employees. So we certainly expect to see a significant growth there as well. And assisted living facilities have been added in this round as well. The other add to this grouping is we've allocated up to $5 million for new businesses that started from January 1st, 2019 to to the end of March 2020. Certainly people had, put their life savings and their livelihoods and their hopes into businesses and started them. The challenge for them in the first round was you can't look at financial trends. The first round was absolutely a financial number equation. People submitted their financials, we'll run it through a disbursement calculator, and the numbers will pop out. For new businesses, you can't do it that way because there isn't a trend. So that will take folks at MTI, folks in our department, folks at the economic development districts to really look at those applications in a different way. And we're working on some of those details now with the, kind of under the supervision of MTI, because that's what they do on an ongoing basis, is determine kind of that viability and the support there. So the application portal opened earlier today. We also took a lot of feedback that we got in the first round and made changes to how the questions are worded, what order the questions are in some cases, some things like that, just to make it easier, or intent to make it easier for people to apply. We took the questions that we got and said, okay, well, if we got this many questions on this topic, somehow we weren't clear either with the question or with the information. And so we tried to clean that up, and we will continue to work on that as we get questions in this round. We've had our first webinar with the Train the Trainers. That went fine, really no questions there. The first business webinar was this morning. We had a couple hundred people on it. And then we're asking really good kind of content related questions. Not a lot of question about should I apply, not a lot of questions about eligibility, just really kind of good core questions about how. So I think that indicates that we've made some progress on that. So with that, maybe Senator Breen, it's a good time to take questions, or Representative Bettine, whoever's.
Thank you, Commissioner. Sorry about that. Representative Jorgensen is waving his hand furiously.
Furious. Fast.
Better be a good question.
Well, I hope it's a good question. A couple of things. First, I just wanted to understand your phase one breakdown chart. And when I'm looking at the column marked total loss with cap, that's the amount of money you provided. That equals the grants awarded. Is that what I'm looking at there? No,
so we haven't awarded any money yet, right? We're still in the validation process, but that's what it would be if you put the $100,000 cap in. So if we said that's not what your loss might be, but if you took it down to the $100,000 per applicant.
So assuming that it goes through as planned, this is sort of roughly where you're going to allocate, probably. Do you think? Is that a fair statement? I'm just curious, just to understand the chart a little bit.
Yeah, the total loss with CAP would be the disbursement expectation or something close to that. Although I do think, MRS needs to look through these documents, right? One of the things that we were very careful with that we learned from other states is make sure you audit the applications, because a lot of states right now are running around auditing disbursements because they didn't audit on the front end because they wanted to put the money out really quickly. We chose to audit on the front end and not try to go collect money that we'd put out and have to deal with. So that was a philosophical decision that we made that we feel actually good about, but it takes a little bit longer in the evaluation process.
I think that's great. If I might just add one more to that.
Yeah.
I'm interested in understanding sort of like, assuming an organization or an entity is in good standing with Maine Revenue Services, say, what are the chief reasons why people might be bumped out? I mean, just because they didn't fill out the forms right, or they failed an audit on their application, or I'm just trying to think about how that process, the adjudication process, worked.
Yeah, so some people submitted and didn't have a loss. So they didn't actually have a loss. And it's what we call revenue minus expenses, because that's what the Maine Revenue Service, it's real. If you think about the core of operating income, it's basically operating income, but MRS can't audit operating income. So you have to audit revenue minus expenses minus depreciation, which is a little bit clunky. But that's the auditable options. So it's really looking at, right, this is, again, a program built on viability. And we recognize that whatever money we put into the marketplace won't solve for the loss in revenue and the loss in profit and the loss of opportunity that people had as a result of the pandemic, but is really just about keeping people viable as best we can, supporting as much of that as possible. So the bulk of the people that we've seen drop out so far didn't have a loss. And I think, right, in talking to a few of them, it was a loss to them because it wasn't what they had projected for their year, but it wasn't an actual year-over-year loss. And so a lot of people dropped out for that. We had a number of people who were in ineligible categories, like childcare in phase one wasn't eligible, and they submitted anyway, I think, being hopeful that maybe we would change our minds or that there would be money and so some flexibility. And now MRS is really taking a fine look at, where are they in good standing tax-wise and auditable-wise. So there will be more adjustments there.
Sure. Well, I appreciate that. Thank you so much for the explanation.
Representative Martin, then Representative Peirce.
Thank you, Commissioner. Wondering if someone under 50 did not apply, they can still apply in this program, right?
They can.
Thank you.
Yep, and we hope that they do. If they, I think as you keep these programs running, more people hear about them, more people see them, more people feel more comfortable with it once you start doing them. So we hope that they will.
Representative Peirce.
Thank you. I appreciate the analysis because it gives a good overview of what happened. And I also, Representative Jorgen took my question, but I just want to compliment you, having known a couple businesses that worked through this. I can't say how complimentary they were about the webinars, about the ability to get their phone calls returned if they were confused. And I appreciate that you reached out to the AFA committee in a way that was productive as well. So I think that it bodes well going forward, and I'm excited to see what happens in the next round because I think that will be very interesting based on that. So if Representative Jorgensen hadn't taken my question, I'd have a question. But anyway, thank you.
Thank you, though. Thank you.
Commissioner, I have a couple businesses in my community, really sort of like, Main Street retail type small businesses that weren't eligible in the first round because they had not been open for a full year. And hearing now that in the second round, there has been some money set aside for that. I'm trying to understand the relationship between those businesses and the role of MTI. Does the fact that that is somehow running through MTI, is that going to limit the actual types of businesses from a substantive perspective that are eligible for grants? And again, I think these businesses are doing the best they can and need the same kind of help that other businesses do.
Yeah, and we haven't gotten the language around this down yet, I think. And so all businesses of any sector that is a new business from January 1st to the end of March can apply. What we're trying to do is leverage the knowledge and the process experience that MTI has in the 7 sectors to evaluate those applications, because they need to be evaluated differently than the ones that we can just run through the financial calculator. MTI will physically take the 7 sectors and handle those as well, but they're also going to help us from a process perspective talk about how do we look at these applications, what is the process for evaluating them as they come in, and that. So MTI will actually evaluate the 7 sectors, but they won't evaluate the other sectors, but they will provide leadership and guidance on how to evaluate.
Right. So again, if one of these businesses, for example, is a retail clothing store, there's still a possibility that they would be eligible based upon how that evaluation criteria is applied.
That's right. Yep. And they can go right into the portal. It's the same portal for everyone. And the new businesses will be carved out and likely get a call because there's so much more there that needs to be known.
Thank you very much.
Yeah.
Any other questions for Commissioner Johnson? Looking at my screen, looking around the room.
This is the advantage of being last.
Well, we're a little bit past the lunch hour. So Commissioner, thank you very much for that presentation today.
Yeah, thank you as well. Have a great day.
Thank you and good luck. Okay, that brings us to the end of our agenda.
It certainly does.
Senator, you have your light on.
I do. I exercise my prerogative. This brings us to the end, probably the last meeting of this committee as it's constituted. And we might have to come in again for some emergency thing, but otherwise the committee won't be meeting again until after elections in the new legislature. So this is our one and only time to pay tribute and give thanks to the folks here who are retiring, stepping off the committee. And I believe Representative Peirce wanted to say a few things about some House members.
Thank you so much, Madam Chair. I wish this was a full roast and we were around a table together and we could all share a few stories, and maybe sometime in the future we can. But I just wanted to take the opportunity, being one of the newer members on this committee, to recognize the people that I've served with in the House and around this horseshoe. And Representative Ketchel, it's been nothing but a pleasure. I think you bring a lot of history to this position, and I have always appreciated your comments and our ability to work across the aisle to get a lot of things done. And I think that that's an important step as we move forward. So you'll be missed. Representative Jorgensen we've served on a couple committees together, and he always has a thoughtful word and some insight that someone else isn't thinking. So I greatly have appreciated that. I know our other House members have as well. There's nothing like spending some time on marijuana, but then also coming to the AFA, and sometime we'll get some revenue on that. But thank you for your all 8 years of service on AFA. I think that that's an extraordinary thing to have been on this committee for that long. And I know that we all appreciate that historical perspective as you term out. Representative Hubble and I started together on education when I was a newbie, and certainly I learned quickly that I knew nothing and he knew a lot. And the acumen that you bring to everything you do, Representative Hubble, is greatly appreciated. And I can't tell you how much I've learned from you, how much I've enjoyed just being around a couple different horseshoes at a lot of different moments with a lot of different challenges. And so thank you for your service. Which brings us to the chair of this committee, who hasn't always been on this committee, and we like to give him a bad time. Sometimes we call him captain in our little circle, sometimes not. But Representative Gattine is terming off as well. His time on HHS, the amount of knowledge that you bring to this committee, the thoughtfulness with which you treat all members of the House and the Senate in terms of listening and taking care to understand their perspective, and then bring that around the horseshoe in a way that I think moves us all forward. You do it with professionalism and a lot of humor and a lot of sarcasm, and that will certainly be missed by a lot of people. So thank you for the time together. I look forward to more maybe more time in the future at some point around different horseshoes with all of you. And I'll turn it over to the good senator and my chair of the Senate. Thanks.
Thank you so much, Representative Peirce. I'm sorry that we don't have Senator Hamper here with us, but I will say in his absence that I have been lucky to serve in the same chamber with him over the last 6 years and on this committee with him for 4 years, and have learned a lot from Jim. I really appreciated his diligence and his commitment to the work, and his gentlemanly demeanor through some very rough, stressful times. And so I wish Jim the best and thank him for his service. And I also want to thank my colleague in my caucus, Senator Linda Sanborn. You know, the first time I was on this committee, I was a caucus of 1. So having a second with me was an enormous gift, but I didn't know quite how to handle it. So she taught me a lot about having 2 caucus members on this committee, and I'm very grateful. Obviously, Senator Sanborn has a lot of history on this committee when she was in the House, and a lot of passion for healthcare, public health, and so many other core state government functions that it's really, really been lovely to have you on the committee. And everybody on the committee knows I've tried for 2 years to get Senator Sanborn to run again, and I feel like a complete failure because she's not running again, but I certainly appreciate the time you have given us, and I know that you're going to have some good times with your granddaughter and your family to look forward to. And then lastly, to my co-chair, Representative Gatine, I just want to say thank you, and what a pleasure it's been working with you as the Senate lead for one session and as co-chair for the second session, this session. And of course, I always like to say, you're the best co-chair I've ever worked with, because I've only worked with one, so it's really easy. But you certainly set a high bar for whoever steps into this role as House Chair. And I've also learned a lot from you, and want to thank you for your leadership. And then also we have a parting gift, and it involves some what's the right word? Some bubbly from one of the watering holes down the street in Hollowell from the Liberal Cup. Believe it or not, they have their own brew called the State Budget Red Ale. And so I was able to procure some to give to our retiring members. But of course, we're not allowed to have alcohol here in the building. So being a rule follower, I left it in my car, but I do have a picture of the bottle, which is kind of fun. So I'm going to try to hold it up for folks to see that it's got its own label. And I had to add the State Budget Red Ale label. And then for each member on the side, there's a little, thank you and the terms that you were on the legislatures where you served on appropriations. So fortunately, Representative Millett lives fairly close, or close enough, I should say, to Senator Hamper. So he's going to deliver that for me, and we'll have to figure out how to get Representative Hubbell's up to him. So again, I really think this past session has been a great restoration of some important traditions and appropriations, and every single member on this committee has played a key role in doing that, and I'm very grateful. So I will close with that. Thank you. And I think we're adjourned. Sorry.
No one said that was going to happen.
Oh boy.
I was able to take
turn off his mic.
I was able to take my 45 minutes of prepared statement and whittle it down to about 20 minutes, and now I can't find it, so I don't think I'll be able to deliver that. But I do have to say, coming to the end of my 4 terms, my 8 years, served 2 terms on the HHS committee, which was an amazing experience, and 2 terms on this committee, and I think we all we all talk about rightly, what an honor it is to serve in the legislature, but I will certainly go so far that to say that the last 2 years on this committee have been a real pleasure. Working with all of you, and I could go around the horseshoe and spend a lot of time talking about each of you, and I'm not going to do that. But I do want to underscore something that Senator Breen brought up. I think the 127th and the 128th, for those of you who served on this committee then, were very, very difficult and challenging times for this committee. And I'm very proud of the fact that I think here in the 129th that we were able to really working together. And I think everybody made a tremendous contribution to sort of restore what I think was a little bit more of the regular order to the appropriations process, to the budget process. And I give tremendous credit to my amazing co-chair. And I always tell people that I have a lot of very good friends in the Maine State Senate, but I feel like I won the lottery when I got to co-chair the committee with Senator Breen. And my Republican leads, Senator Hamper and Representative Millett. Again, I think we formed a very good team working together in the best interests of our caucus, but more important, in the best interests of Maine state government and Maine people. And again, just very, very grateful and happy that I've had the chance to work with the 13 members of this committee over the last 2 years. And again, I don't think this committee can adjourn without acknowledging the amazing support that we get from nonpartisan staff, in particular the folks in OFPR led by Chris Nolan and our amazing principal analyst, Maureen Dawson. We just, what we ask of you folks is tremendous, and what we get back from you folks is even more tremendous. So very, very appreciative of the work of the nonpartisan staff and the partisan staff from all of our offices that help us out in the course of the year. I'm certainly going to miss being here and working with you all, but I think that this committee is queued up to do tremendous work in the future. So that being said, I want to thank you very much, and I'll let you gavel us out, Senator.
Thank you very much, Representative Guttine. And with that, we will stand adjourned. Thank you.